That's what the question is. Well, we should ask them this right now.
be afraid to go any darker in the room. But it's up to you.
Welcome, ladies and gentlemen, to our second annual Breeder-to-Breeder Seminar held in conjunction with the AKC Euclid National Championship. I'm sure we will have having lots more individuals joining us throughout this afternoon. And please feel free to move over to see the screen if you feel that would be more advantageous. My name is Maribeth O'Neill from the American Kennel Club. Probably know most of you. And throughout the presentations, we're asking if you have questions, if you would just jot down a note to yourself. We're going to have a panel discussion at the end. We are trying to keep to a time schedule here today. So, with that said, I would like to introduce our first speaker, Dr. Marty Greer. Has run the Veterinary Village, LLC, small animal hospital in Wisconsin since 1982, working extensively with clients who breed and compete with their dogs. In 2002, she opened the International Canine Semen Bank, Wisconsin Semen Freezing Center, which allows breeders to preserve their dog's semen for use at another time or a remote location. Services provided include fertility and infertility work, TCIs, fresh and frozen semen, C-sections, neonatal care, and pre-breeding health screening. She counsels clients seeking assistance in making dog breeding decisions and frequently lectures on canine reproduction and animal law, as well as doing several presentations for me at our vet outreach program. Dr. Greer has contributed to pharmaceutical and nutritional research as an investigator for Abbott Laboratory, Depernol, Pfizer, Elanco, Animal Health, and Hill's Pet Nutrition. In 2010, she completed her law degree at Marquette University. In other words, she's not an overachiever. She's active in the community, holding offices with the Wisconsin Veterinary Medical Association, Education and Animal Welfare Committees, and the American Veterinary Medical Law Association, the Society for Veterinary Ethics, and the Society for Veterinary Theriogenology. She's board chair of the National Animal Interest Alliance. She's on the ABMA Judicial Council. She's been appointed by Governor Jim Doyle to a position on the Veterinary Examining Board of the Department of Regulation and Licensing. She's also a member of the ABMA, NEWVMA, ASVPV, APDT, AAFP, ACSMA, and the Fond du Lac Kennel Club. And most important, the Pembroke Bush Corgi Club of America. Lakeshore Pembroke Bush Corgi Kennel Club, and the Lamira Area Chamber of Commerce. Dr. Greer, her husband, Dr. Daniel Griffiths, have 2 children, Katie, a parasitologist, and nearly a nurse, married to Tim, and Carl, an IT guy with a physics degree, married to Kelly. In addition, they raise and show Pembroke Bush Corgis and Bernese Mountain Dogs. She's an AKC breeder of They also have cats, rescue dogs, a horse, 4-H dairy heifers, llamas, and sheep. Her family have raised 5 puppies for Canine Companions for Dependents, a service dog organization. And in her spare time, she practices law at the Animal Legal Resources, LLC with Sheila Kessler. Please welcome Dr. Marty Greer.
Thank you. I'm excited to be here. This is a lot of fun. Good to have the Corgi people in the front row. Yay. So I just wanted to start off with a little picture of one of my more recent litters that turned out to be a pretty nice breeding. So I've been breeding Corgis for about 25 years. That gives you a little bit of background on where I come from. What we're going to talk today about is sort of a group of different subjects that may seem unrelated, but what I was asked to talk about is kind of what's new in theriogenology. So we're going to scoot through some things that are sort of cutting edge or things that I think that a lot of breeders unfortunately don't know enough about yet, or veterinarians don't know enough about yet as well. So we'll go through those topics. So tell me what you do when your dog, this kind of dog, you wake up one morning and that's what you find on the floor. And it didn't come from your bench. That came from your stud dog. Wow, huh? That's not good. You take him into the veterinarian. So, any other symptoms besides difficulty marking your territory? So, what do when we find our dog has that bloody discharge on the floor? Do we Google it? Of course. Do you call your co-owner and start crying on the phone together? Probably. Maybe you should call your veterinarian. They might have some input. So, can you do a blood test on a dog? What would you do? Would you start with a CBC to see if they're sick? Would you start with a PSA? Do PSA tests work on dogs? No. PSA tests work on people to determine if they have prostate disease, but we don't have a blood test on the dog like that. You could do a rectal exam. You could do an x-ray. You could do an ultrasound. You could ejaculate the dog for semen analysis. You could do a cytology on that ejaculate. How about a culture? Would that be good? Or how about the CPSE test? Now that's not available in the US at this point, but there is a test around outside of the US that tests for prostate disease, for benign prostatic hypertrophy. So, what are the things that could be wrong with your dog if you wake up in the morning and find that discharge on the floor? There's 5 different things that frequently we can see causing blood in the discharge that comes from the penis, independent of urination, independent of ejaculation. Number 1 is going to be prostatitis or prostate abscess. 2 is going to be prostate cancer. 3 will be benign prostatic hypertrophy. We're going to talk about each of these individually. 4 will be a paraprostatic cyst. And 5 can be a urethral prolapse. Now there can be other things. There can be dogs that have trouble with their blood clotting. They can have a bladder stone. But this is just, you walk into the house and that's what you find on your floor. So, how about a rectal exam? Any veterinarian can do this for you, right? They're pretty simple, they're pretty straightforward, it requires a glove and not a lot of other sophisticated equipment. When you're checking for the prostate is that dark structure right up under if you kind of look at that picture, you can see someone's thumb up underneath it, and the prostate is that dark structure just behind the bladder. So that gives you an idea of when the person's doing a rectal exam, the veterinarian's doing a rectal exam, what they're feeling for. So on the left picture is a normal sized prostate, and on the right is an enlarged prostate. There's multiple reasons for the prostate to enlarge, so we'll talk about those. So, what about prostatitis or prostatic abscess? That's usually caused by bacterial infection, and it's almost always secondary to benign prostatic hypertrophy, and we'll talk about BPH here in a minute. Those dogs look pretty sick. They can be as sick as a pyometra bitch. They can have peritonitis, and they can get really sick to the point that occasionally they can become septic enough that they can die. They're not eating, they're not feeling well, they're vomiting. Some will run a fever, some will have some urinary incontinence, they may walk funny, be real stiff in the back because of pain. They may go into shock, they may have difficulty urinating. Blood work, you're going to see an elevation of the white blood cell count on most of these dogs. The differential things that you're going to be looking for are best served by doing a rectal exam and an ultrasound of the prostate. On chemistry panels, if your veterinarian does blood work, they're going to have some elevations of their alphos. Sometimes they'll be low with their blood sugar if they're septic, and sometimes they'll be dehydrated, so you'll see some changes there. In the ejaculate, you're often going to see a cluster of white blood cells. So with a stained sample under the microscope, you can see this. That big blob of stuff in the middle of the side are white blood cells that are all coagulated together. And then on the outside, you can see sperm that are, well, they're sperm. They're trying to breed something, so they're going to breed the white blood cells on the slide. But you'll see clumping of sperm and groups of white blood cells on the ejaculate. It'll be a pretty different looking ejaculate than what you normally see in a healthy dog. It does require treatment with antibiotics to get rid of the infection in the prostate, but they also need to have their BPH, the underlying hormonal disease, treated either with castration or with medication, and we'll talk about those different choices. Prostate cancer tends to be pretty rare. While we see a lot of dogs every year with benign prostatic hypertrophy, every week with benign prostatic hypertrophy or with prostate infections, we rarely see prostate cancer. So even though that tends to be what everybody jumps to the conclusion of is, oh my gosh, my dog has this terrible thing wrong with him, it must be cancer, we don't see it that commonly, and it is more common in neutered males, which is counterintuitive. Everybody thinks it should be the other way around, that it should be the intact male. But in reality, it's more common in a neutered male dog. Adenocarcinoma is one of the more frequent causes if they have prostate cancer. The other cause can be transitional cell carcinoma. The dogs don't initially look sick, but they do show some signs of urinary problems, including blood in the urine or blood independent of urination. Treatment is pretty grim. There aren't really good ways to treat adenocarcinomas. Transitional cell carcinomas will respond to antibiotics and piroxicam to a limited extent. Most of those dogs don't end up with a cure, but they'll end up with enough control of their disease that many of them will live a year or two with transitional cell carcinomas and appropriate treatment. It's not going to be a cure. The dogs will stay on that medication for the rest of their life. Benign prostatic hypertrophy is really common. This is the one we see the most frequently. I get a lot of phone calls about this. Here we have the dog that, like we showed in the picture earlier, there's blood dripping from his penis independent of urination. He may strain to defecate. He may have flat ribbon-like stools. They rarely have difficulty urinating. Most of the time, it's just that they have difficulty with their stools because of the position of the prostate in the dog. It's different than it is in people. And some dogs will have discomfort or pain on mating. So when they mount the bitch, they'll have discomfort because the prostate is enlarged, and as they mount the bitch, the pressure of their weight against the bitch and then kind of squishing the prostate will cause them to have some discomfort. It's really common in all male dogs over the age of 5. It's frequently mistaken by prostatitis, and many veterinarians' first reaction will be to put that dog on antibiotics. And if they have an infection in the prostate or at risk of an infection in the prostate, that's not a bad choice. But antibiotics alone are not going to fix the problem. So then veterinarians start talking about neutering or castration. So I get lots of phone calls from people that they are concerned that that's what their veterinarian has given them for their treatment option. There are other choices, and we use hormonal treatments to control the BPH, the benign prostatic hypertrophy. It's common in male dogs over the age of 5 because as dogs age, the kind of testosterone that they make in their testicles changes, which affects the size and shape of the prostate. So it's really common, and I get frequent phone calls and frequent visits from people that they have had their dog put on antibiotics and that's been the only treatment that's been provided. Well, it tends to wax and wane on its own. It tends to get a little bit better spontaneously and then come back to flare up again if the dog's been around a bitch in heat. So if he's traveling, if you've got a neighborhood dog in heat, if you've got bitches in heat in your household, then he may flare up again. And it looks like the antibiotics have taken care of the problem, but in reality, it's just subsided on its own and it's going to come back and flare up again. So our treatment options consist of castration, which works really well for benign prostatic hypertrophy, but it doesn't work really well for the stud dog that people want to continue to use in their breeding program. And oftentimes we'll have dogs that come in and they have this condition and they haven't frozen semen on him yet, so they want to buy some time until they can get semen frozen or the bitch that they bought to breed him to bred until they finally decide that castration is a reasonable option for them. Treatment number 2, we no longer can get GnRH vaccine, but for a period of time we could get that, and that was a pretty cool treatment. We also have finasteride, Ovaban, Deslorelin, and Epizin. We'll talk about each of those. This is an ultrasound of a dog that had benign prostatic hypertrophy diagnosed on ultrasound. The picture prior to treatment is on the left. You can see how large his prostate is. Those two straight lines on there are the measurements that we use on the ultrasound machine, so we can measure specifically the distance across the prostate in 2 directions. And then a month later, after treatment was initiated, we've got the picture on the right where we can see that the prostate on the same dog is significantly smaller in size. So, castration, yeah, curative, but shortens the dog's breeding career. GnRH vaccine was made by Pfizer Animal Health, which is now Zoetis. It's not currently on the market. It did cause a transient and sometimes long-term infertility, but it worked pretty well. We used it for a study the GnRH study that Pfizer funded, and it was a pretty interesting product. It was around for a short period of time. Finasteride is our most commonly used drug. Finasteride is also used in people for hair loss. So you grow hair on people. I don't think it really improves the coat of the dog much. But finasteride is also called Proscar, and it's commonly used for treating benign prostatic hypertrophy in people and in dogs. It works quite well. It is not a cure. It does require long-term treatment. So as long as the dog is not neutered, he's going to need to stay on finasteride. It works well, but it does not lend itself to keeping the dog fertile if you're planning to use him during that time period. Ovaban does keep them fertile. Finasteride keeps them fertile. Superelin or Deslorelin does not. Now this is one of the other great European ads. This is Epizin. There's 2 ads that I've found circulated fairly commonly. older guys hanging around with their dogs, obviously very happy. Both these guys are smiling, they're very glad that their dog has not been neutered. In Europe, they treat a lot of their reproductive disorders differently than we do. So we don't see these ads, we don't see these drugs circulating in the United States, but this is what the Epizin ads look like. Epizin is a drug that's given on a once-a-day basis for 7 consecutive days. It comes in a 7-tablet box, and it does a nice job of, again, shrinking down the prostate, managing benign prostatic hypertrophy. Again, it's not an FDA-approved drug, so this is extra-label or off-label as well. So we have a series of 3 different drugs that we offer clients as reasonable options to keep the dogs intact and fertile and control their benign prostatic hypertrophy. With both finasteride and Epizin, the warning label indicates that pregnant women should be careful handling broken tablets because of a specific kind of birth defect. So clients do need to, as owners, you need to be aware of that. And you may be past the age of reproduction, but if you have kennel help, if you have grandkids or kids hanging around your house that are helping you with dogs, make sure that they're not handling these medications. And many of us assume that they are not pregnant, but get pregnant when they're not supposed to. So, those of you grandmas out there, just be aware that you need to be careful with having these drugs handled inappropriately if it's a young female that could be pregnant. So, who's this Veerback company that makes this product, the Epizin, and makes this product, the Super LN, and makes this product, the Ovabam? Anybody recognize this name brand? Veerback? Yeah, you do, right? We don't have any of these drugs in the US, but this is a pretty major drug company in the United States. Name a drug that they make. Anybody can do that? They make the shampoos, right? They make the shampoos that are shown here in the bottom, the Pyoban and that whole line of shampoos. They make the CET dental products. Veerback makes those, the toothpaste, the chew strips, all those products, and they make Iberheart Max. So these are commonly used pharmaceutical agents and products in the United States made by this company, but it's not one that we really associate with the kind of drugs that they show us in Europe because they're just not approved for use in the US. The use here is so limited that the company doesn't have the financial motivation to have that drug approved or those drugs approved in the US. So yep, we know those drugs and that drug company, right? So it's out there, you just have to figure out the best way to manage that. So those are the Veerback products. All right, paraprostatic cysts are not common, but we see them every now and then. We diagnosed one this week at our hospital. We see maybe one of these a year. On ultrasound, this will look like another bladder in the dog's abdomen. So it'll look like the dog has 2 bladders instead of 1. It's a very large cystic structure that's off the side of the prostate, and they happen infrequently but can be pretty dramatic. They can abscess and the dogs can get pretty sick, or they can have difficulty with urination. But they do have some signs of abnormality with their fertility, or they may have bloody discharge from their penis independent of urination. Treatment consists of surgically taking care of this by letting it drain into the omentum, which is a complicated surgery for most general veterinarians, and this is usually going to be done by a surgeon or someone that does repro. Urethral prolapse is relatively common in really young dogs. This is not something you're going to see in the over 5-year-old dog. We see it frequently in bulldogs and some of the other young dogs. That is just the tip of the urethra will extrude through the penis and cause some bleeding. We had one bulldog that had a pretty dramatic amount of blood. These dogs are too young for prostate disease, but it can be fairly dramatic. So it's one of the things that should be looked at if your dog has any bloody discharge from the penis that can't be explained easily. It just takes a simple physical exam and manipulating the penis to take a good look to see what the tip of it looks like. So that's what causes bloody discharge, and many of those are very treatable, and we can keep our dogs intact. So, this is who I am. I run this veterinary clinic in Lamira, Wisconsin, which is about halfway between Green Bay and Milwaukee. I have these fabulous people that work for me. This is my husband and his favorite Facebook picture of him in our barn a number of years ago when our kids were in 4-H. I have these great doctors that work for me. These are my kids. The book. There's a green flyer outside the room. This book has been a long time in the making, and it's to be released on Monday. So we just missed the weekend for this, but this is a practical guide for veterinarians, veterinary technicians, and breeders. It's written to be really hands-on practical. What do I do at 2 o'clock in the morning when something's going wrong with my litter, with my bitch, with my male? So it's really just, like I said, very, very practical, very hands-on. It's written for everybody in the room. So if you're interested, it's going to be available. It's already available on Amazon for pre-order, and the flyer has information on it, as well as some other really great books that go well with breeders' information. So this is Dr. Zella. These are the people who made it possible for me to be here today, because they're home doing the stuff that I usually do when I'm there. Dr. Moore, Dr. Kowaleski, and Dr. Dowling. So those are my docs, and thanks to them for running the place. They're fabulous people. So we're going to talk about additional things here. We're going to talk about some fresh and frozen semen information, pyometra and the bitch, and then our spay neuter controversy. And as I understand it, Dr. David Waters spoke a little bit ago, and will be speaking again today, about lifetime ovary exposure and how that relates to longevity in the dog. Study the old gray muzzle tour. So, frozen semen breedings. This is what we want. We want a maximally sized litter. This is a Bernese Mountain Dog bitch. We're waking up from her C-section. It's a little hard to see in the picture how many puppies are there, but she had 13. This was a breeding that we did a number of years ago, and the client had been told by all of his friends in Bernese Mountain Dogs that Bernese Mountain Dogs don't get pregnant with frozen semen. I don't know. Did you want more than 13? That seemed like plenty to me. So, done well, frozen semen breedings can be very successful. So we're going to talk about a number of different topics today: timing the bitch, vaginal AI, shipping semen, frozen semen, TCIs, surgical inseminations. So for about 35 years, people have been freezing semen, veterinarians have been freezing semen, and non-veterinarians, to use later on in a different location or in a different time period. We're using semen right now that's sometimes as old as 30 years old and still successfully getting litters of puppies from it. It's pretty exciting to bring that longevity, or that depth of pedigree back into reality. But for most of the time, the success has been limited by our ability to do progesterones. We have to have exact timing, because the semen with frozen semen lives a short time in the bitch's reproductive tract. So the more accurate the progesterone testing has become, the more successful we've been in being able to produce great litters. In '95, we did our first frozen semen breeding. This is Bingo. She was an 8-year-old bitch. We got progesterone level results back. It took a week. A week is a pretty long time to go. It now takes us 45 minutes. And the staff goes a little nuts when they're standing at the machine staring at it, wondering what takes so long. You know, we kind of threw a dart at the calendar on this breeding and said, well, I think this is probably the right day. She had 2 puppies. I think this is the right day to breed. But for an 8-year-old bitch with frozen semen having absolutely no information on progesterones, we were pretty excited that we got this. So now we know, with better timing, that we can have some pretty amazing litters. That's an underlitter of corgis. That's a little litter of 10 that I had. So what is the who, what, when, where, why, and how of using fresh, chilled, or frozen semen? So we'll start with who the people are. So who are the people? And that would be any breeder interested in expanding their genetic opportunities outside their chronological or geographical area without traveling a long distance in time or space. It's pretty hard to go back in time. So like I said, when we're using semen that's 25 or 30 years old, it's pretty cool to be able to do that. It keeps you from having to ship bitches or take yourself halfway around the world if you want to use genetics. I proudly own a Danish-Swedish farm dog as well, and when I get ready to breed her, there aren't a lot of Danish-Swedish farm dog stud dogs in the US. So I'll have opportunities to breed her to stud dogs I wouldn't have if I didn't use fresh chilled or frozen semen. So it's any breeder willing to go to the additional time, trouble, and expense, and we recommend that you use a veterinarian who's had some experience in this modality. It takes a little bit of attention to detail and some practice. So I'm not saying that you shouldn't start off with a veterinarian that doesn't have some experience, because everybody has to start somewhere. But you want to try to make sure that you have the best outcome by using someone that's got some experience with this. So who are the dogs that we want to use? Well, we want it to be a healthy, sexually mature dog. We want him to have passed his appropriate genetic screening, who's got the great temperament, the superior specimen of the breed, and shows promise of great longevity. Isn't that what everybody wants in their stud dog? That's the perfect package, right? So everybody wants a smart dog. or a highly competitive dog. These are some pretty high-powered dogs that are big winners. And of course, we have our big winners in the conformation rings as well, agility, all those different events. And sometimes it's just because there's nothing wrong with having a really great pet dog. This is an adorable little puppy I sold to some people in Chicago, and I'm pretty sure when that little girl wakes up, she's going to have a grid pattern on her cheek that matches the tile on the floor. So, we're going to define a little bit of terminology, the what of this, and that's fresh semen is semen that's collected at the time it's to be used and inserted immediately. And that's when both the stud dog and the bitch are on the same premises. Fresh chilled or extended semen is collected usually around 24 hours prior to insemination, depending on if it's a weekend or a holiday, because you know that's when your breedings are always going to happen, right? Over Christmas, when Christmas falls on a Monday and you can't get a shipment anytime between Thursday and Tuesday. So you collect the semen 24 hours prior to insemination. It's transported from the location of the male to the location of the bitch. That's usually courtesy of FedEx, UPS, the Postal Service, one of those delivery systems, but sometimes clients will do the drive instead. And then we have frozen semen. Now that can be collected at any time in advance of its use. It's frozen in liquid nitrogen and stored until it's ready to use, thawed, and immediately inseminated. So then we have to use specialized insemination techniques, which we'll talk about. The stud dog does not have to be available. He can be deceased, he can be in another country, he can be neutered. Once the semen is collected, then his business here is done. So then we'll define some other terms. Artificial insemination. People throw around AI quite a bit. We have fresh AIs, which are both the dog and bitch on premises. We have fresh chilled, like I said, that avoids the travel and the shipping. We have frozen when the stud dog is unavailable, and that's done either with surgical or TCIs, but not vaginal inseminations. We have surgical inseminations, and then we have TCIs, and we'll talk about each of these. I made up this little chart because I think it's a little bit confusing to figure out how you use all the semen all the different ways. So natural breedings, obviously, are fresh semen. Vaginal AIs are done with either fresh or fresh chilled semen. We can use transcervical inseminations for fresh chilled, or for frozen semen. We can do a surgical breeding for any of those three kinds of semen. Multiple sire breedings I'll just talk about very briefly, and that can be done any of those three ways, and that's when more than one sire is used, and then the dogs are DNA tested, the puppies are DNA tested along with any potential fathers and the mother to determine who the sire of, or sires of the litter are. And then you can do combinations. We'll have some people who want to put in 2 different dogs. We'll have some people who want to put in some fresh and some frozen. You know, it's really a lot of different variation just depending on what the breeder desires and what they really have for goals. So there's a lot of discussion that goes on with this decision making. So this is what a natural breeding looks like. This is a tie. I didn't get the AI done in time in my office. So I had to get out the camera and take a picture of what a natural breeding looks like, because we so seldom see those. You guys do those all without our help. This is a Wisconsin tie. These 2 dogs were in a tie long enough that the client started to feel sorry for them and took the Barbie blanket out and draped it over the dogs so that they didn't freeze during the time that they were in their tie. When we use fresh chilled semen, the semen comes in a styrofoam shipper, sometimes in a stainless steel thermos, depending on how brutally cold the weather is. We'll throw in a stainless steel thermos when we have temperatures below 0 in Wisconsin and it's coming from the north. Semen coming from Canada is not coming from a good place when it's so cold that it freezes in the back of the UPS truck. Frozen semen that way doesn't work out too well. So we have the fresh chilled box that comes. We have our lovely little Finnish Lapland bitch here waiting for her boyfriend to arrive. He's shown up in the box. And then we have frozen semen. There are either pellets or straws that we can use for that. So when do we breed? We inseminate during a normal estrus cycle. We like the cycles to be as normal as possible. So if you have something odd going on with the heat cycle, we're probably going to discourage you from using any kind of sophisticated breeding like frozen semen. We want to have a nice normal cycle. We want it to be a young and healthy middle-aged bitch who has passed all of her health screenings and has all the same criteria as our male with good temperament, promise of good longevity. We like to use a young, healthy adult male, but any age male that has viable sperm is still eligible. After the age of 12, AKC requires paperwork to support the fact that the dog is still viable if we're collecting semen at that point, but that's no big deal. We can easily do that.
So when we collect semen on the males, we like to freeze early and freeze often. Obviously, this puppy is too young, but as soon as they start producing sperm, I'm okay with starting to freeze it. So for the timing on the bitch, we need to have very careful timing done anytime we're using shipped or frozen semen, because the semen isn't going to live as long in the reproductive tract as it will if it's fresh. And it's also helpful for any stud dog or any bitch with a history of fertility problems. So if you have a male with substandard semen, or you have a bitch that's missed, you want to have really great timing, because that's going to improve the chances that you have a fertile breeding. And everybody's goal isn't to spend a lot of money and end up with nothing at the end. Everybody's goal is to end up with a wildly successful litter. So timing is critical, not only so we know when to breed, but because we also know then when she's due to whelp. If we know the day that the bitch ovulates, we can predict within a 24-hour window, plus or minus, the day that she should be due to whelp. So that makes everybody's life a lot easier if we have a bitch that has a small litter, or if a bitch that is likely to need a C-section because of her breed or other circumstances. So it's really great to have your timing up front so that we can then know what day she's due to whelp. Our goal, of course, is to have a successful pregnancy and a successful outcome for that pregnancy. At our office, we use this spreadsheet. My clients affectionately call it the rainbow sheet. We put in the date that the bitch was bred, and from that, the computer automatically calculates when she's due. So it goes through and tells us when we should take out sutures if she was a surgical breeding, when we should do the ultrasound, what day we should start our panicure therapy. And I don't have a slide on that, but I am going to briefly mention that we do use panicure, or recommend panicure, for almost all of our pregnant bitches, starting on day 40 of their pregnancy and continuing through day 14 of their lactation. That significantly reduces the transplacental and transmammary transmission of parasites, roundworms and hookworms. So we have healthy, happy little fat puppies that don't end up with that 3-week-old kind of not feeling very well during the parasite migration into the gut stage. It then goes on to tell us if we should put on our DAP collar for planning a C-section. We use those on our bitches. What day to do the C-section and what day she's due to whelp. So this is a pretty handy little piece of paperwork that we hand to our clients. They put it on the refrigerator, and then they've got their schedule all set out for the rest of the pregnancy on the bitch. So why is timing critical? Can I just sort of let them figure it out? And can I just breed on day 12 and 14? I mean, that always worked before, right? Well, we're spending a lot of money. We may have limited availability of semen. We may have a risk to the bitch if she's carrying a pregnancy that she's only going to have 1 or 2 puppies because we didn't time our breedings as well as we should. There's a cost to missing a breeding. There's a cost to you of how much you spend on the semen and on the stud feed. There's a cost to you for missing a litter because you don't have puppies to sell to those people who have been waiting. And there's a cost to you of having your bitch start to age at a time that you really need a litter of puppies out of her because she's getting up into an age group that she's no longer likely to be fertile. So those are all costs. Maybe not financial costs, but they're still costs. And we have to worry about our aging stud dog as well, as we have those boys who are getting a little bit older, and we worry that our young bitches may not be around when the stud dog is, or that our stud dog may not be around when our bitch is. So we want to make sure that we're really pretty effective in getting our timing done correctly. It affects litter size. If we're too early or too late, our litter sizes are going to be smaller. And that's important in our successes. So how do we time for breeding? Well, we have the stud dog. He'll tell us when he's interested, right? Sometimes he's pretty accurate, and sometimes not. Sometimes they're timid or they're afraid of the bitch. There's a lot of reasons that the male dog may not be accurate on his timing. We have the bitch's receptivity, so she should tell us, right? Well, not always, because some of them are really bitches. We have vaginal cytologies. We have vaginoscopy, where we look into the vagina and see what the tissues look like. We have progesterone testing, and we have LH testing. Now, some dogs are pretty suave, and they will bring her roses. And then we have the other dogs who are kind of klutzes, and they would bring dandelions. We all know those. This is a picture of the dandelion dog. He was simply not able to finesse the bitch into believing that a breeding was a good idea. She was standing like a rock. He was not so good with an AI on this breeding. But sometimes you just know that it's not going to work out. You have a clueless male, you have an even more clueless female, and sometimes you just have to intervene. So our vaginal cytologies can be helpful, and in the old days, this is what we had to go on because we didn't have progesterone tests. The slide on the left-hand side is a slide of a bitch in proestrus. She's got cornified cells, but has white blood cells in the background. And then the slide on the right is the bitch on her way out of heat. So the cells are still cornified, but now we have white blood cells in the background. That's not a good enough determination for me to know what day to put in frozen semen. And I have clients that spend, $2,000, $3,000, $4,000, $5,000 on semen. I'm not gonna throw $5,000 worth of frozen semen in a bitch based on a vaginal cytology. I need to have a lot more accuracy when I'm doing those kinds of readings. And we use progesterone levels because my staff, in spite of how great they are, do not have a crystal ball. They cannot tell you what day she is ovulated unless we do something pretty specific like progesterone testing. It's an easy test to interpret. It's readily available. Almost every hospital can get results back now within 24 hours, and some in less time than that, depending on where you live. And it's a reproducible test. From one lab to the next, the results are pretty consistent. So progesterone has really become the test that we use the most frequently. There are different kinds of progesterone tests. There's a quantitative test, which can be run on a piece of equipment, either at a reference lab, like IDEX, Antag, Marshfield, or one of these two pieces of equipment, and there's also an Immunolite. The one on the left is the TOSA machine, the one on the right is Immunivitis. And a lot of veterinary clinics that do a fair amount of reproduction will have pieces of equipment like this in their hospital to get us results back quickly. The wells on the bottom, those little pink wells, that's a semi-quantitative test. It'll give you an idea of when she ovulates, but there's no numbers associated with that. The numbers written across the top are the dates written by the client who was using this, but they're not actual results. So when I'm doing a progesterone test, I want to know I have a result back of 4.6 or 7.2. I don't want to have bluer than yesterday or pinker than before. That's not accurate enough. When you're successful and you have these nice big litters, that's when clients realize how important timing really is. There were 14 in that litter. So a progesterone test is the most accurate way that we can time readings. We don't like to do the semi-quantitatives if we can get our hands on the quantitatives. LH tests are also helpful, but there's been some problems over the years with using those. This is Marshfield's flyer from a couple of years ago, Timing is Everything, progesterone testing. And this is how they tell us to interpret the results. In dogs, follicular luteinization occurs prior to ovulation, but, or it can be used to estimate ovulation timing. 2 days prior to ovulation, serum progesterone levels increase from non-detectable to values up to 2. Serum progesterone progressively increases to peak at 4 to 10 at the time of ovulation. Since ovulation takes 2 to 3 days to complete, the optimum breeding time is 4 to 6 days after progesterone reaches 2. What does that mean? I mean, that's what the test results tell you at the bottom of it. What does that mean? Well, I don't know. I just go back to this. So we know that bitches have a progesterone rise prior to their ovulation. It coincides with the LH peak, when as soon as the LH peak occurs, which is that very short window of time in there that has LH above it, that's when we see the progesterone levels start to rise. And as the progesterone rises, then the bitch enters, ovulates, enters her period that her eggs mature, and then enters her fertile period. So what do I do with progesterone levels? I'll tell you that this is what we do, is the magic numbers are 5 and 20, and there's a typo on this slide. So 5 tells us when she ovulates, and then we breed with frozen semen anytime she's over 20. We like to breed somewhere between 12 and 20 with fresh semen and over 20 with frozen. We breed 48 hours after ovulation with fresh semen, and this is where the typo is it should say 72 hours after ovulation, if it's over 20 with frozen semen. So 2 days later after ovulation of 5 at our lab with fresh, and 3 days later with frozen semen. That's consistently what we do. Different veterinary clinics are going to have some slightly different twists on this, but that's generally the way that it's going to be interpreted. All right, this is what an LH test looks like. For a long period of time, we couldn't get the test kits at all, so that's when we stopped typically using them. There are advantages to them. They tell us exactly what day the bitch ovulates. The disadvantage is that every 24 hours, we need to do a blood test on this bitch to determine what day she ovulated. And I don't have a lot of clients or a lot of bitches that like to come in every 24 hours at the same time of the day to have this blood work done. So we tend to use more of the progesterone levels. So why do we do some of these in extended semen breedings? Well, we may have a non-receptive bitch, we may have a disinterested male, we may have incompatibility in size, we may have a male or female that's physically unable for a variety of reasons. So we also may do them because we have semen that needs to go somewhere else. This is semen that we shipped over to Sweden and produced a really nice litter of puppies over there. So does it work? Yeah, it does. It has for a long time. We have nice litters to show that it really does work. And on my website, I have some information on how to use fresh chilled and frozen semen. It's very easy to get semen into the US. It may be difficult to get semen out. If we're doing fresh chilled semen, you want to plan ahead. You want to have a shipping kit well in advance of the time that the breeding needs to be done. We need to time our bitch, plan our shipment, plan for overnight shipping. Airline counter-to-counter shipment is really a very difficult thing to do any longer. And then at the very last minute, this is where you go into panic mode because you know it's going to be a weekend, a holiday, or something has gone wrong. You can't collect the stud dog, or the shipment gets lost. Something can terribly go wrong, and so then you have to change your plans, and then you get around to insemination. Does it always go wrong? No, but it happens often enough that you need to have a plan B in mind. These are our mail order brides. This is how we use our frozen semen shipments. We like to have our tubes labeled. The slide on the right shows the dog's name and the breed written on the tube. Please make sure if you're shipping semen out of your veterinary clinic or if you're doing it yourself that you put the dog's name on the tube. This week we had 2 shipments that came in the same day on 2 different dogs, and one was labeled and one was not. So, that's when you realize that it's really important that you label every tube because we don't want to create mixed breed litters by mistake because we have unlabeled semen arriving at our veterinary clinic. It goes into a styrofoam box. It does not go into the styrofoam box looking like this. This is a tube rubber band to the frozen ice pack. That's not going to work. So please don't do that. That's actually a shipment that we got into our office. It needs to have a little bit of a barrier of newspaper between the semen and the chilled pack and then the ice pack. So instructions are pretty clear that come with the kits. Just follow the instructions so that you do it correctly and remember to label the tube. The finished package looks like this, and then we go ahead and ship with, well, usually FedEx. But like I said, sometimes things get lost along the way. Sometimes it just doesn't work out the way it's supposed to. So we count on FedEx or UPS frequently. And if you learn nothing else from today's presentation, I want you to realize that there's an arrow in the FedEx label. Has anybody ever seen that before? Yeah. Once you see it, you'll never look at a FedEx truck again without looking for the arrow. That's how you know that that's not really the FedEx logo because there's no arrow in there. So there you go. So from here on, you will see the movement in the FedEx logo. So UPS, FedEx, US Postal Service frequently work well. Do you have to use a veterinarian? AKC has recently changed that so that you no longer need to for fresh chilled semen. But we still like to because we like to have a semen evaluation along with a sperm count, and we like to know viability of the semen, motility, and morphology. So it takes a lot of attention to detail and great communication on the parts of all the people involved to make sure that the right semen gets to the right place at the right time. In frozen semen, it also takes a lot of coordination, but it may take up to a year to get semen overseas to certain countries, especially the island countries. It can take sometimes as little time as a week, but it can take up to a year for Australia and some of those other countries. So you want to plan well in advance. Again, we want to use our healthy bitch, and we'll talk about our different techniques. Frozen semen that we use is frozen in pellets. We freeze this way, so it comes out in pellets, looking like this, a lot like Dippin' Dots ice cream. I've made Dippin' Dots, it's kind of fun. We also see semen frozen in straws. There's a lot of discussion among veterinarians which is better, and which is better is whatever works for you. There's good success with both techniques. Semen tanks that we store in do not have electricity. They're stored in liquid nitrogen. And we ship in dry shippers, which are about as high as your knee. So there's some size and cost that goes with that. We want to make sure our dogs are genetically screened and that he's somewhere between 2 and 5 is our ideal age. We want to make sure that he's still producing good, viable semen, but that he's old enough to have good semen as well. Freeze early and freeze often. Try not to bring dogs to us that look like this. This is an actual case that came to us. The dog was sick with cancer and they were hoping that they'd be able to collect semen. This is not the time to start backpedaling and realizing that you've missed that opportunity time to freeze your dog's semen. So as soon as you have an eligible looking dog, he doesn't have to have his championship. He doesn't have to be finished. But you know who your young up and coming dogs are. So those are the times to start freezing semen. When you use frozen semen, we want to use our resource wisely. There's a limited quantity of it in almost every case. It needs to be done with perfect timing. so we have good outcomes. Here's my lawyer hat. Please have a contract with the people that you're working with, especially if it's a friend. That's when those relationships really fall apart, is when you think you thought one thing and they thought another, and if the bitch didn't get pregnant, do you get another breeding or not? And this is how friendships fall apart. So put it in writing so that you have very clear definitions of what you're expecting with a frozen semen, even with a fresh child breeding arrangement with somebody. It will save you a friendship someday down the road. So please make sure you put this in writing. Transcervical inseminations are more frequently being done now. Some veterinarians are doing them exclusively. We're still doing a few frozen semen breedings if we've got a bitch that has a particular reason to be bred that way. This is what TCI looks like. That's one of my corgi bitches on the table. We use a long 27 centimeter scope with a camera attached to it, and then next to it is the TV screen. So we're able to visualize the cervix, and with the endoscope, slip a catheter up into the cervix, into the uterus, and deliver semen into the uterus directly. If you're looking at it anatomically, the scope goes upward and then forward into the vaginal lumen, and then we find the cervix. On a picture that comes from a camera, you're going to see the cervix, which is that pinkish, kind of bumpy looking area, and then the green tube in the center is what the catheter looks like as it's delivering semen into the uterus. It's very cool. The drawback to transcervical inseminations is we can't get our hands on the uterus, so we can't tell if she has cysts or other pathology in the uterus. You can easily visualize where the semen should go with most bitches, but we can't do anything about any uterine pathology because we can't see it. I'm not sure if this video is going to play. I don't think so. So I'll put this video up on our Facebook page. It's a video of us doing a TCI. But essentially we put the bitch on a hydraulic table, we raise the table, she comes up to shoulder level, and with her standing, with no sedation, without any anesthesia, we have usually one or two people, usually the stud dog, or the bitch owner near her head so that she feels comfortable that she's there with someone that's with her. And then we have another staff member helping hold her and a staff member managing the semen. And we'll be able to inseminate the bitch, usually within about 2 minutes of the time that we get her onto the table. We can find the cervix and successfully cannulate it. Then over the course of the next 10 minutes or so, we'll inseminate whether we're using fresh chilled, or frozen semen. So it's just set up that easily. It's really a pretty straightforward procedure. The difficulty in these is that it takes a long time to learn how to do them. There's a learning curve that goes with it from a veterinarian's perspective, and it's pretty expensive equipment. So it has to be used in a practice where there's enough use of it to justify the cost of the equipment. It's running around $15,000 or so to set up for a TCI to do that. So who's a candidate for surgical inseminations? Let's talk about surgery. The advantages, disadvantages, and costs. With surgical breedings, that's a full anesthetic procedure with a surgical breeding. We exteriorize the uterus and directly put the semen into the uterus using a catheter. Now this does not impact future breedings. The bitch can still be bred and the bitch can still have a C-section, so it's still very successful. Some of the advantages to it are that it is your greatest chance of having a litter of puppies, and it doesn't require $15,000 of equipment. Any veterinary clinic that can successfully do a spay will be able to successfully do a surgical breeding. It's pretty cool. We can put our hands on the uterus. We know exactly what's going on. And it's a pretty short and easy procedure. She's in and out the door in about 2 hours. If we're going to do one of these, we'll start off with a semen collection. And this is one of the series of pictures that a client took for me. She took a picture of the clock and then timed everything for us right out from there. We collected and processed the semen. Took a look at it, made sure it was viable, did a sperm count, extended the semen, got ready to anesthetize the bitch, put in an IV catheter, anesthetized, prepped her, moved her into surgery, shaved her, had her under anesthesia, hooked up to a monitor. That's my husband monitoring her. Here we are getting ready for surgery. There she is on the table, beautiful view of the dog, right? Made a small incision, exteriorized her uterus, so that's the uterus of the uterine body. So for those of you who haven't had the chance to see one of these up close and personal, that's what they look like. We have the semen in a syringe. We put the catheter into the uterus, inject the semen into the uterus slowly so that the uterus has time to expand. sew her closed, staple her up, and I did not turn her from a Gordon Setter into a Nova Scotia Dog-Toiling Retriever. I just didn't take a picture of her as we recovered her. So we recover them hind end up in the air, and we're done. So it's a pretty short procedure. It is invasive, more invasive than a TCI, but like I said, it doesn't require some of the equipment, and it has some of the advantages of being able to check more carefully what's going on inside the uterus before we do anything, especially if we're going to thaw out frozen semen. We want to be sure that the semen quality and the uterine quality is good enough. And this is what we produced. And yes, Gordon Setters do come in different colors. And there they are. These are serosal cysts. We often see these on the outside of the uterus if a bitch has had a C-section in the past. That does not impair fertility. So just because you see those doesn't mean the bitch can't get pregnant. Those bitches can still be bred. Those are not the kind of cysts that we're talking about when we talk about popping cysts. These are the kind of cysts we're talking about, and these are actually in the lining of the uterus. They look like bubble wrap. They're just little cysts, one on top of the next, on top of the next. These are bitches that don't get pregnant. If there's a few cysts, there's some really hot arguments that go on the Theria list. If you want to start a fist fight, a cyber fist fight, you can start off by saying, I think popping cysts, I think not popping cysts fixes the problem. Well, there's a lot of discussion about it. Nobody has a really good controlled study on it, but we know that this is what cysts inside the uterus look like that impair fertility. There's no place for placentas to attach. That's just not a uterus that's going to be fertile. So this was a bitch that was meant to be bred surgically, but at the time of the surgical breeding, it was determined that her disease, her cystic endometrial hyperplasia, was so severe that we spayed her instead. She was on the fast track for other issues with her health. So, how long does frozen semen last when it's stored? We don't know, but we're using bull semen that's at least 40 years old. We know dog semen is still at 30 years old, doing well. When we wake it up, it swims just like it did when it was first frozen. In a regular AI vaginally, we just put the semen in vaginally. When we're doing frozen semen, we want to put it into the uterus because we have huge differences in conception rates. If vaginal inseminations are done, we get about 11% of the bitches pregnant with frozen semen, but we get around 83% if it's put into the uterus directly. So, let's talk a little bit about our bitch. We're going to talk about treating pyometrius medically, interrupting pregnancies, and SIPs. So pyometrius, everybody knows what pyo is, right? Pyometrius strikes fear into the heart of all bitch owners. It's become a verb in most people's vocabulary. My bitch is pyoing. I think my bitch pyoed last month. So we have that now as a verb, not just a noun. It's rare in the young bitch, but I have seen it as early as the first heat cycle. And it's most of the time seen in bitches that are somewhere over the age of 8 or 9. Only humans and gorillas go through menopause, dogs do not. So remember that she will continue to have heat cycles throughout her life. When a bitch's reproductive life is over, it's still recommended that we spay her, and we'll talk a little bit about that in a few minutes. But overall, the statistics show that about 25% of bitches over the age of 9 get pyometra. Now in 2012, a really interesting study was presented at the International Symposium for Canine and Feline Reproduction. It was a study done out of Sweden that listed about 120 breeds of dogs and their incidence of pyometra, their incidence of mammary tumor, and their incidence of both. So on this slide, you can see that Bernese Mountain Dogs lead the way at 62%. 62% of Berners, if they're not spayed, end up with pyometra. Close behind them are Great Danes, Leonbergers, Rottweilers, Irish Wolfhounds. So those are our top 5. Those are all giant breed dogs, all from European descent. I think there's got to be something going on here that's genetic. I think there's little question that there's some tendency that the precursor to this giant breed group of dogs that we see out of Europe were probably affected by something that causes pyometra. We don't understand it really well, but that's a pretty high percentage. So if I had a bitch in one of those breeds, I would start talking about spaying her as soon as I'm done with her reproductive life. Then we still see Staffordshire Bull Terriers, K-Sounds, Bull Terriers, Bouviers. So the list is on and on. You can find this article if you Google search it. It's a pretty interesting article to take a look at if you have the desire to know what your breed incidence happens to be in both mammary tumors and pyometras. This is what a pyometra looks like surgically. It's a pretty nasty, big uterus full of pus. We need to get rid of those. We can do them surgically, but there is also medical management. And we've been successful in treating bitches medically for pyometras for close to 15 years. My daughter had a Bernese Mountain Dog bitch many years ago that had a pyometra. we were successful in treating her bitch. So it's been working for a long time. This is what happens when you don't spay a pyometra. You get puppies. This is a bulldog litter. She had a litter of puppies in one horn and a pyometra in the opposite horn at the same time. This is a Amstaff bitch that we did not end up spaying, but she ended up producing 8 puppies after we did medical management and detect, which we'll talk about here in a minute. These are her puppies. Pretty soon they were bigger than she was, and this is my daughter's litter of Bernese Mountain Dog puppies out of her bitch that we did not spay. She had a pyometra when she was 2.5, bred her at 3, didn't get a pregnancy at 3.5. This is what we got. She ended up having another pregnancy at 7. So it can work and it can be very successful. This is her litter as well. If you set the right expectations for clients, they can understand that there are certainly good outcomes from medically managed pyometras. Do they all work all the time? Absolutely not. But there are no guarantees in fertility and nothing works all the time. So our medical management of pyometras, this is a summary of it. Of course they need an antibiotic because there's a bacterial infection, but the antibiotics don't penetrate into the uterus particularly well. So along with that, and by the way, bitches with pyometras do not typically run fevers, so if you're waiting for her to have a fever, if you think she's got a pyometra, you're going to wait way too long to see veterinary care. So please don't assume that a fever is going to be happening with this. I don't understand why there can be that much pus in the uterus and the bitch doesn't end up acting like she's got a fever, but they don't run fevers. I think there's some discussion that needs to happen on that. Along with antibiotics, we use prostaglandins. Now there's a couple of different kinds. We typically use Luvalice, and we typically give 5 injections a day. In Europe, they have a drug called Alazine, or a hormone called Alazine, that's also helpful in treating these, but again, that's an extra-label or off-label use of drug in the United States. So we typically will use prostaglandins. We'll walk the bitch every time she has an injection. So in January, my staff that smokes fight to get a chance to take care of the pyometra bitch because they get paid to go outside and smoke a cigarette and walk a dog. Nobody else wants to walk them in January, so it works out pretty well. So we give 5 injections of low-dose prostaglandins a day. Along with that, they need fluids. If they're vomiting, we'll put them on Reglan. If their progesterone level is still high, we'll put them on bromocriptine or cabergoline to help drop the progesterone level. If the cervix is not opening up readily, we'll use some misoprostol at the opening to the cervix. And one of the new procedures that we've been doing that is still unpublished, but there's some information circulating out there, is called the TECT procedure. Now, if you end up in an emergency clinic and it's 2 o'clock in the morning with your pyometra bitch and they want to hover over her with a scalpel blade, if you can get them to start her on IV fluids, well, you know how they are. If there's an excuse to spay, they're going to find it. So if you can get her started on fluids and some antibiotics and get her, through the night, a couple of hours, and get her to your repro veterinarian in the morning and get her started on prostaglandins, you can still save her uterus if she's not too sick. Now the question is, what's too sick to treat medically? What's too sick to treat surgically? There are definitely bitches that are better off treated medically when they're really sick because they just simply may not be a candidate for surgery. Dr. Hutchinson has one of my favorite quotes, and that's, I've seen a lot of bitches too sick to go to surgery with pyometras, but I've never seen one too sick for an injection. So there are absolutely bitches that will respond very well. We had a collie bitch a number of years ago that was so sick, there was no possible way she was going to make it through surgery. We treated her medically. She didn't lift her head for 36 hours with her owner sitting next to her on the floor. She didn't move. And on hour 37, she decided she was going to live. So you can treat some of these bitches medically and be very successful. The TECT procedure, like I said, is an unpublished bit of information. It's been circulating a little bit around the Therio group. And essentially what it is the use of the endoscope to place a catheter up into the uterus and flush the uterus or lavage the uterus out. This is a golden retriever bitch standing on the table. In our office, there's some discharge. It's a little hard to see with the color of the slide, but there's some discharge. And essentially what we do is the same thing as when we do a TCI, in that we introduce the scope into her vagina, we pass a catheter through that up into the uterus, and then we irrigate the uterus with lactated ringers to help flush out the uterus. That combined with the other parts of the protocol, these drugs, we've been pretty successful in treating these dogs. Do they all get pregnant? No, but we've had pretty good success. That bitch, the Amstaff bitch that had 8 puppies that I showed you a picture of, she had had Luvalice, antibiotics, and the TECT procedure done and was very successful in carrying her pregnancy. I've got a bitch coming in this coming week that we bred 3 weeks ago and she'll be ultrasounded to see if she's pregnant. We had treated her also with the tech procedure. So it's a pretty interesting procedure. If it's a veterinarian that you're working with that has an endoscope, you may want to talk to them about whether this is a treatment option for them. This is what the uterine bifurcation looks like through the endoscope, so you can see both uterine horns with the scope. Okay, so what happens if your bitch gets bred by the wrong dog? Do you have to spay her? No, you could spay her. The first thing you want to do is ultrasound her and see if she's actually pregnant. If you've done a cytology and you found sperm, odds are she's pregnant. But 62% of bred bitches are not pregnant, even when there's a witness breeding. So you can either let the bitch whelp and then DNA the puppies to determine who the sire is. You can spay her, or you can interrupt the pregnancy pharmacologically. Typically what we've been using for the last 5 or 6 years is cloprostenol. It's a series of 2 injections, 4 to 5 days apart, along with some bromocriptine or cabergoline to drop the progesterone level. And we've had, with the exception of one bitch, 100% success. We had one bitch that was a large breed bitch, a Great Dane, that had a large litter, and in that bitch we also added alazine to her treatment protocol. But again, alazine is a U.S., is not a product that's available in the U.S., but we've had very good success with the cloprostenol product. It's a horse product, again, extra label or off-label use, but it's worked very successfully for us to eliminate a pregnancy, and then you don't have to spay your bitch. You've got an alternative to treatment. You don't ever want to use estrogen at the time of mating. The old DES or ECP that we used to use, the estrogens are risky to bitches. The very first dog that I ever saw that used on was a Samoyed. When I was a senior in vet school, I saw her die. So we know that it's pretty serious to use that, so we instead want to use some of the newer treatment protocols. You cannot treat earlier than day 24, it just simply doesn't work. So you have to wait until they're far enough in their pregnancy to ultrasound. If they're ultrasounded and found to be pregnant, we do 2 injections at 4 to 5 day intervals. There will be some bloody vaginal discharge and sometimes some tissues are visible, but it's very successful. There's also new treatment for SIPS. SIPS is subinvolution of placental sites. That's when you see about 4 to 6 weeks after a bitch whelps, you'll see a bloody, bright red, bloody vaginal kind of a mucousy discharge. Just a bloop of it on the floor. It's not continuous, but it'll happen periodically when the puppies are old enough that you just think that that shouldn't be happening anymore. It's not a pyometra, it's not metritis, the bitches aren't sick, but it's this bright red bloody vaginal discharge. And there's a new treatment that was published in October of 2013 that uses this, again, this drug Ovaban, at starting off with a higher dose, dropping to a lower dose for a treatment of 14 days. And it's been shown effective in that group of dogs. 7 of 7 dogs successfully were treated for SIPS. So it's an alternative. Don't let your veterinarian talk you into spaying her. It is not pyometra, it is not metritis, it is not serious, but it should be treated to prevent too much blood loss in the bitch. Okay, rendering male and female dogs incapable of reproduction. We, again, like I said, used to have a GnRH vaccine that was pretty successful in both males and females, but that's currently unavailable. So there are other options that are injectable that are under development. But as an alternative, some of the things that we've been using in our practice have been either vasectomies in the dogs or ovary-sparing spays in the bitches. I believe, like I said, Dr. Waters was talking about lifetime ovary exposure and longevity, so I think it's interesting that there's a lot of clients that are coming along wanting these kinds of procedures. Dr. Benjamin Hart published an article recently in a veterinary publication that talked about longevity and the differences in Labradors, German Shepherds, and Golden Retrievers in longevity. There's a Wiesla study out there. So there's some strong evidence coming on that dogs that are not spayed or neutered have greater longevity. And we also see some other advantages as well. We know that the male dogs will improve or keep their good muscle tone, have a lower risk of obesity if they're not neutered. We know that he'll retain his normal coat, and for some breeds that's pretty important. We know that the dogs will have a lower risk of cancer in many cases, especially Golden Retrievers, a 4 to 5-fold difference in Golden Retrievers. Have less cancer, less lymphoma, less hemangiosarcoma if they're not neutered. The exception to that would be testicular cancer, and if they develop testicular cancer, it's pretty easy to diagnose. You can find it, you can feel it, you can remove the testicles. They rarely spread to other organs. There's a lower risk of thyroid disease and a lower risk of joint disease, especially in Golden Retrievers that are not neutered. The disadvantages are you're going to have ongoing male behavior. That would include marking territory or roaming. You're still going to have a dog that may want to breed bitches. They don't have a decreased risk of prostate disease, but they don't have an increased risk either. and they aren't protected against perineal masses or perineal masses and perineal hernias. But we have an increasing number of clients that are interested in vasectomies as a way to control their dog's reproductive capacity. They can still mate, but no one really expects them to. But the main thing is that they're not able to reproduce. So it's a nice way to be able to manage the male's fertility without losing their coat, losing their muscle tone, and losing that protective effect of testosterone. In the bitches, there are some people that are leaving the uterus and taking out the ovaries, but you don't get the protection against some of the things that we'll talk about. Tubal ligation is currently not being advised because there's still some risks that go with that. But the ovary-sparing spay is another really interesting thing. So we're leaving ovaries on purpose. There's actually a Facebook page for this, so if anybody's interested, you can find ovary-sparing spay Facebook page. I had no idea that there were enough people interested in it, but there are. So that number of people is growing every day. Again, in the bitch, the advantage is she'll retain good muscle tone and has a lower risk of obesity. She'll retain her normal coat. You can tell a spayed bitch coat a mile away on some of the bitches that we see. Samoyeds, my gosh, they walk into the office and you know they're spayed. You don't even have to ask, right? They have a lower risk of cancer, except for mammary cancer. They have a lower risk of thyroid disease, a lower risk of joint disease, again, particularly in the golden retriever, and a lower risk of urinary incontinence. You do not have a lower risk of mammary cancer. In fact, mammary cancer is probably increased. But again, mammary tumors are easily diagnosed, and if they're removed when they're small, almost all bitches are successfully treated with just removing the lump. She will have ongoing sexual behaviors. They may have some vaginal discharge. But we have clients that are now asking for this ovary-sparing spay procedure or vasectomies. In the old days, they used to be able to sue me for leaving ovaries. But now, I get paid extra for leaving them in. It's a pretty good deal. Yeah. So, I just want to mention briefly National Animal Interest Alliance, for those of you who may not be familiar with it. It's your ally in your legislative assistance in dogs and keeping dogs in your lives. So keep an eye on what NAIA is doing. It's a pretty important group. I want to briefly mention a few things about what's new this year, and that's the AKC Theriogenology Residency Program. The Therio Foundation is pleased to announce the establishment of the AKC Therio Foundation Companion Animal Residency Theriogenology. It's at 3 schools right now. We're hoping for expansion. We have students at University of California, Davis, at Auburn University, and the University of Pennsylvania. There are 3 residencies which began in 2014, and they are supported by a generous grant from the AKC. I brought along some flyers. They're out on the table if you had a chance to pick them up. From the Society for Theriogenology. These are the purple flyers. And this is a starting point for a strong collaborative effort between the 2 organizations, AKC and Theriogenology. We have with us today our 3 residents. We have Dr. Natalie Fraser from Auburn. You want to stand up, please? Dr. Andrea Hesser from UC Davis. And Dr. Carol Margolis from UPenn. These 3 aspiring theriogenologists are our future in veterinary medicine. These are the people that we need to look to. There's a rapidly changing world in a lot of places, and we're hoping that this combination will help us with healthier litters, help us with predictable aptitudes and temperaments. It's an important group, and it's important that we support them. So we're hoping that you'll be part of Theriogenology's future and supporting these young students. So please introduce yourselves to them. Please welcome them to this group. It's very exciting to have this opportunity to have Therio and AKC in this collaborative effort to educate residents. It's an expensive course of study, so we're glad to have the AKC's support. I'll conclude with, we give dogs time we can spare, space we can spare, and love we can spare. In return, they give us their all. It's the best deal man ever made. I can be reached at, that's one of those adorable corgis. That's really mine. I can be reached here. So if anybody has anything that they need, you can certainly send me an email, give me a call, check us out on Facebook, whatever you need to do to find us. But thank you for letting me speak today.
We have to get the next program loaded. brief break after Mr. Kelly speaks to us. Mr. Kelly is an alumnus of Auburn University, where he received his BS in Animal Science in 1988 and his MS in Animal Science in 1998. He served on the staff of Auburn University from 1992 to 1997 as a research specialist in the area of growth and developmental biology for the Department of Animal and Dairy Sciences. While at Auburn University, his research efforts focused on myogenic regulatory mechanisms during embryonic and neonatal development of domestic livestock. In 1997, Mr. Kelly accepted a position with the Ions Company as a research associate with the Strategic Research Group. He's currently senior scientist for the Technology Development Group and leads research efforts in reproduction, growth and development in canine gastrointestinal health. Mr. Kelly has published numerous scientific papers and abstracts on canine nutrition, influences of physical stress, and regulatory influences of animal growth and development. Thank you and welcome, Russ Kelly.
Thank you. It's a pleasure to be here. Thank the AKC for allowing me to be part of this session. This afternoon I'm going to basically talk a little bit about just offering an idea of you possibly utilizing probiotics as part of your breeding program, both for the management of your bitch and for in terms of today, we're going to really just sort of highlight some of the gastrointestinal orders that can take place in the dog, and then take a look at the maternal benefits and puppy benefits of possibly using probiotics. In terms of GI disorder, these can arise from an array of different activities: dietary indiscretion, inflammatory events, parasitic, bacterial issues, physical or psychological stress, and then trauma stress. All of these can end result in having some GI issues. In terms of diarrhea, there's really 4 types of diarrhea that we deal with: osmotic diarrhea, secretory diarrhea, increased permeability, and then mobility disorders. We're really just going to focus on the top 3 in terms of this. Osmotic diarrhea, this is normally associated with issues in digestion or absorption, such as poorly digested fats. Secretory diarrhea is usually associated with some chemical or biological agent. This could be enterotoxins from bacteria or other biological agents. Increased permeability, this is really barrier disruptions, and this can be caused from inflammation. It can also be caused from osmotic problems, and it can also be associated with secretory problems. The mobility disorders, we really won't get into that much today because I haven't seen any data that indicates that probiotics offers a benefit in the dog relative to this area yet. In terms of osmotic diarrhea, this can be caused by several different points. Nutritional overload. This is simply just consumption of very large meals. Malabsorption, so this could be either there's a digestive issue going on with the animal, or the diet has some non-digestible components. Impaired digestion, that could also be associated with a diet, or enzymatic in nature. Mucosal damage. When we start talking about here, the GI tract, and we'll show some pictures later on, the GI tract is lined with a mucosal layer, and this is very important in terms of maintaining GI health. Enzyme deficiencies, and then along with several associated diseases. In terms of secretory agents, most of the time what we see this is really associated with either some type of chemical agent, whether it's bacterial source or exogenously formed. And then mucosal damage, this can be done from an array of different types of bacteria, viruses, or parasites. In terms of GI function, the intestinal mucosal is basically it's a protection layer for the body in terms of protecting against food particles, bacteria, viruses, or other ingested particles. And we save that primarily for the puppies. As you know, they all like to chew on all kinds of little things that they get that into their GI tract. But any of these materials that can come in contact with the epithelial cells can cause damage to those cells. thus creating a compromised system. So the intestinal mucosa is very, very important. In terms of the probiotics that we're going to talk about later on, this is where they actually interact with the body. The probacteria embed themselves in the mucosal layer, and this has been shown, depending on the strain, to basically inhibit pathogen bacteria from binding into the mucosal layer and causing the associated damages. You can see here through this picture, this is just sort of a cartoon of the GI tract, and you can see that the epithelial cells that line the GI tract, separating it from the lumen. And you get the little gray picture here at the bottom. The pointer's not working, but you can see that that's the sort of mimicking the mucosal layer. And you can see that the bacteria that are associated with the GI tract can interact with it through either dendritic cells or other openings in this. And when we get problems, we get inflammation up at the left side towards the top, there where it says injury. When these cells get damaged, the spaces in between the cells become wider, and we start getting increased intestinal permeability or leakage. And this is where we run into issues. When we get increased intestinal permeability, we have the opportunity there for bacterial translocation. So this is bacteria that are intended to be in the lumen of the GI tract, are now migrating across the GI tract and entering into the body. And this can cause quite the issues. Protein or peptide migration. So if we have large enough openings and these proteins start to migrate across, then they become involved with the immune system. This is one of the developments of allergies. And then ion migration. And really, this is really just dealing with trying to maintain ion balance across the GI tract. It's intended to function in a one-way street. And when we start having ions flowing back and forth, then it becomes difficult for the animal to maintain that ionic balance, and we can start seeing some GI issues from that. Stressful conditions, when we have animals under stressful conditions, we get a sympathetic activity, and we get an activation of the mast cells that are associated with the GI tract, the central nervous system, and with that we get increased mucin release, and I'm sure that all of you have seen this in your dog's feces. When dogs get slightly stressed, you start to see mucus secreted on their stools. We get increased permeability of the GI tract, and we get increased ion secretion. And more or less what we end up with is we end up with poor stool production, and for the most part, it generally does not present a health issue to the animal, although if it's severe enough, it can. This is a sort of a cartoon to indicate here the nerve fibers associated with the central nervous system. You can see that the mast cells are associated with that, and when the mast cells become activated, they start releasing compounds that can start to impact the epithelial cells and increase, especially during the lactation period for the bitch. We want to make sure that in terms of the fluids, that if she's losing fluids, it's through milk, not anywhere else. So we'll move on here to just considering the use of probiotics during reproduction. This is a friend of mine's lab bitch who produced these puppies. They all did quite well. So in terms of probiotics, we'll start off by really just defining what is a probiotic. There are certainly, you read a lot in the magazines these days about the use of the probiotic. It's basically a beneficial bacteria that when is provided live and in sufficient amounts can elicit a positive response to its host. Doesn't mean that it will, but that's the theory. Now, in terms of that, I'm sure that all of you have seen probiotic, and there are hundreds and hundreds and hundreds of probiotics that are out there. I've dealt in this area for about the last 10 years, and with that, I can only tell you that while it is painted as a broad brush that probiotics can help this, it's generally associated with a single strain or a couple of strains that help with each of those areas. So it's not just that it's a one bacteria fixes everything. One bacteria may be good for inflammatory events, others may be good for combating pathogenic bacteria, or it could be that there's a strain that helps some with this, a little bit with that, and a lot with something else. The strain I'm going to talk with mainly today will be the one that we provide is a bifidobacteria, AKC7. So why a concern with GI health for the breeder? Well, certainly nutritional overload takes place with during every lactation period, where we're trying to increase their intakes 3 to 5-fold above their maintenance levels. Now we can help with this by simply increasing the number of meals that we offer, rather than trying to feed a really, really large meal 2 or 3 times a day. We will get much better results in terms of that if we can go to 5 or 6 smaller meals. We can also get the bitch to eat more with that, through just that practice. If you look at peak lactation, when they're trying to, when they're metabolically burning 8 to 10,000 calories a day producing milk for their puppies, if we can go, 6 meals, 8 meals, I can almost guarantee you can get more calories in them in that than trying to do it with 3 big meals. And we don't create as many GI issues. In terms of the stress, well, certainly there's the physical stress metabolically of producing milk and caring for these puppies. There's also the mental side of it. As I mentioned earlier, certain bitches don't like to have a lot of help or oversight. We as humans tend to like to provide help and oversight, and for some of those it doesn't work out so well. And then there's also a practice of sort of being a little more overprotective than what we maybe should be with a bitch, in terms of making sure that she really stays with her puppies all the time. Getting them out and taking them for walks in safe zones. It's not a bad thing to get them out and let them have some exercise and relieve some of the physical stress that they're going through. And then just from an environmental standpoint, they are consuming lots of materials that the body was really not intended to digest, trying to keep their whelping area clean, and it does create a stress on their GI tracts, particularly as the puppies start to get a little older, and now their bacteria loads and their GI tracts are starting to become colonized with bacteria. Every time the mother eats the puppy species, it's about 50% bacteria that she's consuming. So they're consuming lots and lots of bacteria through that system. In terms of the study that we did, we looked at 12 bitches. It's kind of a small study. We're hoping to expand this out. But basically, they were all on a common diet throughout the reproductive cycle. And then we started using a supplemental treat at day 30. So as soon as they were ultrasound and confirmed pregnancy, we assigned either to a control or to a AHC7 containing, and here we use 2.3 billion bacteria per day to do that. And they were administered one single treat in the morning with their first meal of the day. The breeder owner kept up with everything through a journal. They scored the fecal data on a 5-point scale, kept up with the intake, and we defined a GI event as a stool score of 2 or below on the 5-point scale, where 5 being a dry, hard stool, 4 being optimal, 3 being foreign but soft, 2 without foreign but soft, and then 1 being liquid diarrhea. And we basically took that from feedback from your colleagues, what is an acceptable stool for them, and it was pretty clear that we came back, anything 2 or below, we're not interested in having. So we set that define that as a GI event. And then we also, in terms of the fecal collections, we collected those at baseline at day 30, day 56 of gestation, and then day 30 of post-whelping. And we basically analyzed that through qPCR to look for the microbial populations. I mentioned this earlier. This is the stool score that we utilize, with 2 or 1 being defined as unacceptable. I think all of us that own dogs, we're really not interested in dealing with that on any type of routine basis. In terms of the fecal populations, you can see that at baseline, We found very, very little AHC7 in any of the populations, but by day 56 of gestation, so 26 days into supplementation, we get a near significance separation there. That's a p less than 0.1, although it looks much, much bigger than the control group. That's dealing with the fact that it was a pretty small study, so the variability sort of prevents it from being significant. But certainly by day 30, we know that we've significantly increased the AHC7 populations. We have a question back here.
Did I miss what is AHC7?
It is a bifidobacteria. The official name is, and I'm going to say this and qualify it, it's a bifidobacteria animalis AHC7. Okay, and that AHC7, we worked with a company from Ireland to isolate that, their elementary health. So it was elementary health, canine isolate number 7. And, but that bacteria is going to be undergoing a name change as it goes on almost monthly in the bacterial world as tests become better and families become more defined. And this bacteria is one of those that is going to be undergoing a name change to Bifidobacteria pseudoloma instead of animalis. So, but it's a bacteria that is marketed by the IMS company. It is canine derived, so it's isolated from dogs, healthy dogs, and it's found, in about 10% of the population. It's found in sort of measurable levels. Most of the time, it's very, very low levels that it's found, and in some dogs, it's not found at all. So it is a canine-derived bifidobacteria.
Thank you.
You're welcome. In terms of with the vets, we found that we really did not have an impact during the gestation period. So from the time day 30 of pregnancy through them whelping, however, the number of GI events was fairly low. In lactation, we did get a significant decline in the number of GI events in the AHC7 supplemented animals. And with this said, although we followed them throughout the lactation period, probably 75% of the events occurred in the first 2 weeks of lactation, with most of those occurring in the first 10 days. So really, it was really dealing with the decrease of these GI events during the early lactation period. What about the puppies? We talked a little bit about the vets. Let's talk about the puppies. Certainly from a puppy standpoint, we're dealing with an animal that has a very immature immune system, very immature digestive system. It's subjected to numerous environmental challenges such as relocation and pathogen exposure, and then there's the possibility that it's going to undergo several dietary changes, which can also create some issues. In terms of the digestive maturity, I mean, we've got data that shows even up to a year of age, the puppy may not have an adult-like immune digestive system. And generally with that, what we see in the puppies is decreased protein digestibility capability, decreased lipid digestibility capability, and then the decreased ability for fluid management in their lower GI tract. And if we look at that, that's why puppies' fecal matter is a little bit higher in moisture than the adult, and thus they're always sort of on the verge of breaking with loose stools. It may not be a true diarrhea, but their stools become very, very soft, but it's mainly from a standpoint that they're always on the verge of creeping above that 75% moisture in the fecal matter, which is kind of a break point in terms of a stool being able to maintain its shape. In terms of the probiotic, again, we used 12 litters. We had 74 puppies, 37 on each of the groups, 37 on AHC7 and 37 on the control. We started giving the probiotic treats at day 35 of age, and this was just prior to them getting introduction to a gruel. So they had not received any nourishment outside of the mother up to this point. And then I have to apologize for this slide. It says 9 weeks. We actually followed them just through the first 6 weeks in the new home. to evaluate, again, how many GI events took place. The puppies all consumed a common diet. We did collect serum and fecal matter for them on day 35, so prior to the AKC7 being introduced, and again on day 52, which was just prior to them being relocated to their new homes. For the fecal samples, we did qPCR for microbial analysis, and then the serum, we looked at the immunoglobulins and stress markers. I'm not going to really deal with the serum samples today in terms of the data that was generated out of the new home. There was daily fecal scores, again on the 5-point scale, food intakes, and copies of medical records that took place, and then a weekly questionnaire. If we look at the AKC7, you can see that both groups at baseline were very, very similar with regards to that population, but we did get a significant increase in AKC7 in the supplemented pups at day 52. If we look at this is E. coli. Again, you can see that both groups were very similar to their E. coli levels at day 52, but supplementation with AKC7 did attenuate the increase of E. coli as the pups age. And probably most of that is associated with the fact that they're now starting to consume puppy food, which, as I mentioned earlier, they are not 100% completely digesting that food, so that the non-digested matter gets down into their lower GI tracts and can result in other bacterial growth. In terms of the puppy raisers, one of the questions we asked them at the end, these are all experienced puppy raisers, we asked them, how did the puppies transition into the home with regards to house training, and there was about 8 questions that were asked that accumulated in terms of the transition. And we did get a response that the AKC7 puppies did transition much better than they expected in terms of those aspects. What about GI events? If we look here at the 6 weeks, you can see that the aspers at week 1 and week 2 indicate that there were significant declines in the number of GI events that took place in those puppies. And then both groups sort of became closer together in weeks 3 through 6. But overall, we got a significant reduction at early points, both week 1 and week 2, by using this supplementation. Overall, what we found was that 80% of the puppies experienced at least one GI event in the control group, that number actually surprised me a little bit when we got these numbers back, that I wasn't quite expecting that. We've since done additional studies and found pretty consistently that somewhere between 70 and 80% will experience a GI event somewhere during this new home transition. So 8 out of 10 puppies, but by providing the probiotic supplementation, we were able to drop that to around 55%, a significant reduction. So just to sort of start wrapping up, what we did find was that AKC7 supplementation was effective in increasing the fecal populations of that probiotic in both the puppy and the bitch. It reduced the number of lactational-induced GI events in the bitch. It attenuated the rise in E. coli in the puppy, and was able to reduce the number of GI events that a new puppy transitioning into the new home, newly weaned puppy transitioning into the new home experience. It did, based on feedback, improve the transition, although we'll need to follow up on that to figure out exactly what that can be associated with. So I'm just going to finish up by again stating that probiotics is probably a management tool that you could at least consider bringing into your tool shed to manage both your bitch and as you start to wean your puppies and ship them off to new homes. And again, I'll restate sort of what I did at the beginning, that probiotic is not just a probiotic, that you really need to investigate what strain you're going to use. There are lots of products out there available. Some have good data, some don't. Some have been shown to be, I know that one of the competitive products that comes in a powder form, I'm sure you all know what that is. It certainly had some good data that with regards to some of the immune immune parameters that's been measured, as well as some GI in healthy dog or adult dogs. It does not have data in other areas, just like us. We have good data in certain areas and non-existent data in others. So with that, you really need to do your investigations in terms of what strain you're going to use, and make sure that it at least has been tested in the canine model. So thank you for your time, and look forward to the panel discussion later on.
Before we take a quick break, I just wanted to let everyone know that we are live streaming this currently during these presentations, and there will also be, at some point in the future, maybe not until January, that this will be available online on our website. So if there's your friends who maybe didn't get here, would like the opportunity to hear or see some of these presentations, they will be available. So, that being said, we're going to take a 10-minute break. So that's 5 of 3 to be back to start with Jimmy and Sherry Roses.
Exactly, and it's not the dogs. That, they,
And that's why I went down.
excited. I mean, I've got Ladies and gentlemen, we are going to get started again. All right, so we are very fortunate to have with us this afternoon Jim and Sherry Moses. I think pretty well known to most of us as very, very successful breeders. They were the Breeder of the Year in the herding group a couple of years ago, the AKC. But they also are owner handlers and judges. We've bred and owned over 200 German Shepherd Dog champions and have also bred champions and registered merit bitches and Cavalier King Charles Spaniels, Pembroke Welsh Corgis, Poodles, and Labrador Retrievers. So exposure and experience in many breeds. We've won the national specialty numerous times and have exhibited the top winning show dogs, male and female of all times, as well as 2 other exhibits and achieved 100 best in shows and more. We maintain an active breeding program and were the recipient of the 2008 AKC Herding Breeder of the Year and the 2009 Lloyd Brackett Award presented by the German Shepherd Dog Club of America. Please welcome Jim and Sherry Moses.
I'll have to bear with me here. This is my first time doing something like this. I'm going to just tell you a little bit about us for those of you who don't know us. Jim got his first German Shepherd at 9 and his first champion at 13. Went on to have a spectacular career showing dogs. I had my first German Shepherd at 5, bred my first litter at 17, and met Jim at a dog show. So, we, at that point, Jim said we're handlers, not breeders, and it was a bit of a conflict of interest, and we advised clients, but we weren't actually breeding our own litters anymore. Then, like all of us who have dogs, Jim started showing a dog that he really liked. And I had, my old bitch had died, and I made arrangements to lease a bitch for me that was somewhat similar in the pedigree of my old girl. And he said, you know, we can breed another litter, that's fine, because he liked that dog. Next thing you know, we have 5 litters. But the flip side of breeding, the heartbreaking part, that dog produced a tremendous, he himself was a very wonderful animal. At one point he was number 2 all breeds. But he produced over 30% hip dysplasia and tremendous numbers of megaesophagus. I put 22 puppies to sleep before 12 weeks of age. And I almost never bred another litter again. It was horrible and heartbreaking. Fortunately, the litter that we had bred, when I decided I can't take this, I'm out of breeding dogs, we had placed her with a friend. And meanwhile, we had finished a nice show dog named Dallas, and we were deciding who to breed her to. I said, well, how about that dog? And Jim said, oh, that's great, I love him. So our friends bred to that dog. And she had 10 very healthy puppies that I loved. And next thing you know, there we were again, breeding dogs. And we haven't stopped since. So they tease me in our breed that my mantra is, I want it all. You know, they're going to tell you when you start trying to breed dogs that, oh, I remember when I started, you know, I had German dogs growing up. And here I was with my little German dogs going to the matches. And I think that's how a lot of us got started in conformation. We maybe did obedience, or we did something else with our dogs, and we went to somehow we made it to a match. And the people said, somebody said, oh, that's a pretty dog, have you shown it? Well, I don't know, can we show? And so you go to the dog show and you get a ribbon, and you get bitten by the bug, and next thing you know, that's all you can think about. When's the next dog show? How far is it? Can I get there? And, then, it's not enough to get a ribbon. Now you want to win. So I wasn't happy with my dogs, and I decided, well, I want to win them. And I bought a bitch that was a Grand Victor's daughter, out of a Grand Victor's daughter. And by 10 months of age, she had a number of health issues. The first thing came up, and I called the breeder, and she said, well, you got to give a little bit if you're going to have show dogs. She had demodectic mange. Oh, all show lines have that. The next thing you know, puppy had mild hip dysplasia, and I was really not happy. One thing was, they kept telling me, oh, you can't have her, you got to give a little. Well, then she was 10 months old and tried to bite my child, and I sent her back and said, okay, back to the drawing board. At that point, I was fortunate to get a good dog, and went forward from there. But they're going to tell you can't. People are going to tell you, oh, you can't have this. You can't have it all. You have to give. And there is no perfect dog. But from someone who went to, you can't. I have friends in Labradors, and some people quote don't care about health clearances. Well, that doesn't need to be. In German Shepherds, we have a number of dogs. We have a double Grand Victor. He won the national specialty in the U.S. and Canada. He received the Award of Excellence from our parent club. He's herding titled. He's temperament certified. He has the CHIC from the health organization. We have 3 dogs that are best in show winners, that are performance award merits. The 2 boys are stud dogs for guide dogs for the blind. In Labradors, we have a champion master hunter who's OFA excellent, and a breed grand champion. You can have these things. It's not easy, but you can. You just have to try and use some common sense. So, breeding good dogs isn't easy or simple or a matter of luck. It's hard work, and it can be heartbreaking. But if you're passionate about your breed and your dog, it can become a life's work, and it can be the greatest joy you'll ever have in your life, except for maybe your children. But maybe these are just your 4-legged children, so pretty much the same. And it's hard in some respects to be a breeder today. For many people, numbers are very limited. The old days when you could have a lot of dogs and try breedings, they're gone for most people. Several years ago, I think I had 4 or 5 bitches that all came in season, and they, for different reasons, they all had to get bred, and don't you know it, they all conceived. And I had 4 or 5 litters of puppies in 1 year. So I'm at a specialty a few months later, and a friend of mine came to tell me, so-and-so and so-and-so up there, they said you were at Puppy Mill. And I was like, really? Okay, well, which Register of Merit, Best in Show, OFA Excellent German Shepherd bitch should I not have bred this year? But the thing is, it's not politically correct to breed dogs anymore, certainly not to breed numbers of dogs. And economically, it's expensive. So our numbers are limited, so you have to put a lot of thought, not that you wouldn't anyway, but it's not as easy as it was when it was easier to breed more dogs. But here are my suggestions for someone who's trying to establish a consistent line of quality dogs. First off, you need to study your standard and understand the essence of your breed. Go to shows and look at the catalogs. You see a dog that you love going around the ring, go grab that catalog and say, who is that? Make a note on it. You see a dog you hate, it's very fun. At dog shows all the time, I'll see one going around and think, oh my, And I'll go look at the catalog, and I say, hey, can I see the catalog for a second? And a friend will look up at me like, why do you care what that is? I said, because I don't ever want to go near that pedigree. So, pay attention to catalogs. Ask questions, and don't be afraid. Most good breeders would like nothing better than to talk about dogs all day long. I mean, don't ask them when their dog's walking in the ring. But any other time, say, just find a second, say, hey, is there some time I could talk to you about your breeding program? And most of them won't shut up. You know, they would like nothing better. What freaks me out sometimes is I get people that tell me, oh, I wanted to talk to you 2 years ago, but I was just intimidated. I don't think you want me. You know, don't be questions. You know, if they don't want to answer you, I mean, try to be polite. I usually make it to my second or third, question before I say, why do you think your dog has clearances? You know, but try to be polite how you ask, but you should be able to talk to them. Find a mentor. As you're doing this process, you're going to find people that you can get along with. Find a mentor. That's really in my opinion, having a good mentor that can offer their own experience is the way to get started. For those of you who are established in your breed and just looking to do, a new outlook on things, talk to your friends. I don't understand why it is, but some dog people, and honestly, I think the best breeders are all pretty open about things. A lot of breeders get very, closed-mouthed, or I don't know if it's because of our egos or we're afraid somebody's going to know something bad about us. But I think that if we're going to continue in this sport, we all have to be honest with each other, both about our dogs and our breeding programs. This is an ongoing subject in my current club. It shouldn't be if I breed to your dog or you breed to my dog, it shouldn't be a surprise to any of us what we find in that whelping box. So the other thing you have to find, and I thought that the first presentation was really wonderful, is a good veterinarian. There is nothing in the world worse than trying to breed good dogs and not having a good veterinarian. It is so frustrating, as someone who sends out semen on a regular basis, to be trying to deal with it. I feel so sorry for some people because the vets that they're using just either aren't cooperative or think breeders are bad or just don't have the knowledge that they should have. I have veterinarian people telling me, well, my bitch is at 1.1, my vet wants you to ship semen tomorrow. And I'm like, that's really going to cost you a lot of money because we're going to do it again and again, maybe one more time, But find a good vet. And you know what? I get people that tell me, oh, there's a really good repro vet, but they're an hour and a half away. I go to my vet that's 20 minutes away. Now, my vet, well, I used to, I am blessed. One of my veterinarians is the guy whose deerhound won the garden, the repro guy whose deerhound won the garden a few years ago. And the other one is a Labrador person who also does reproduction. So, I'm fortunate. But one of them is an hour and 20 minutes from my house, and one's an hour and 40 minutes from my house. I do not have a local vet. I go to them for everything. Veterinarians tend to not be particularly happy with people who only call them at 3 in the morning for a C-section, and they go to a local vet for all the stuff that would be their bread and butter. So something to think about when you're trying to establish a good relationship with a veterinarian. You want their time and best efforts, you should give them yours also. So, what do you think about when you're thinking about a breeding program? You want type, you want structure, you want soundness, and you want health and longevity. Those things are all equally important. Now, a lot of my feelings are based on my breed. We've had good success in other breeds. I think in all those other breeds the same things apply. I'm sure there are people out here in the audience who have breed-specific issues that some of what I think and how I think are maybe a little different. But I think those things are all just really important. And part of it is because we're really fortunate that German Shepherds have a ready group of people who want a German Shepherd as a family companion. And the majority of our puppies now go to companion homes. And I think that we as breeders have a responsibility to those people. We cannot let our desire for our next champion do a disservice to our breed. So I think it's our responsibility as breeders to make sure that every litter we produce is as healthy and sound and has as good, good temperament, just is a good breed representative that can go off and be the kind of dog that those people are going to say, I want another German Shepherd. When my dog dies when he's 10 or 12 or 14, and we have a lot of 14-year-old dogs, I want them to come and want another dog. And that, for us as the show crowd, is what makes us more acceptable to the rest of the world, as opposed to a shelter dog. We don't want to be bad breeders that don't care about health issues because all we want is a champion. That's what they say on TV, right? So, now you're ready to get your bitch, right? You want to get the very best bitch that you can. A lot of people, I hear them say, well, I got the one that was breeding quality. I don't think it's bad, but I have champions I wouldn't breed. It was like people would say, oh, these are the show dogs, and then these are breeding quality. For me, it's the other way around. There's breeding quality, and then there are dogs I can finish. Some dogs that are breeding quality may not be the best show dogs. But don't settle for mediocre. Get the very best bitch you can. And if it means you save up a little longer, or in our breed's case, a lot of the very best bitches that are available for someone on a limited budget or getting started, or maybe you don't have the contacts in the breed. In German Shepherds, we have a long coat recessive. Those animals frequently have excellent structure. And it's a simple recessive. There's a test for it, in addition to the fact that most of us know who carries what. One generation, that's gone. You breed to a dog that doesn't carry a coat factor, you get an entire litter of absolutely beautiful puppies that they're not long coats. A bitch you're going to see in pictures in a little bit, she's the top producing dam in the history of the breed. Her mother is the one that we were able to get an absolutely beautiful, beautiful bitch. Tremendous virtue. But she was a little cowpox. The owner had gotten frustrated because at all these 5-point majors she'd go reserve, and the judge would say, oh, she was magnificent, but she's cowhawk. So they put up this mediocre kind of animal over her that was just a dog because of this little problem. Well, we saw that and said, oh, we can fix that in one generation. And we did. And it worked out really well for us. So don't look past the obvious, but get the very best bitch you can to get started with. And look at her family. You do not want the princess in a bunch of paupers. Do not get, if you're fortunate to be able to afford or have someone who, says, oh yeah, she's fabulous. Look at her litter mates. Look at her mom and dad. Those are the animals you're going to get when you breed her. I would much rather have the plain but well-made sister in a beautiful litter if I was starting out to breed a dog than a beautiful one in an ugly family. So, now you're looking for your son dog. You want to get the very best dog for your bitch. That may not be the most winning dog. If you have a beautiful bitch who's maybe a shade long in loin, and the dog that just won your national specialty is a beautiful dog, but he could be a little short coupled. Just because he's the grand victor this year does not mean you should breed to him. You'd be shocked how many people, that's exactly what they do. Oh, he was grand victor, I'm going to breed to him. Well, he has the same virtues and flaws your bitch has. How's that going to help you? How's that going to move you forward? How's that going to give you the end result you're looking for? You need to breed for the dog that is going to complement your bitch, but also change what you would change, or you're going to try to. You need to study the pedigree. I am a big fan of line breeding. In our breed, I know in Labradors, very few people line breed. And I've asked why, and because I see a great difference in type and quality, even within a single litter. And the answer I got was because, well, they didn't used to line breed at all because there was such a problem with health issues. And that makes good sense to me because we want healthy dogs. But nowadays, we have so many, we're fortunate, we have so many genetic tests available that some of that's not really an issue anymore. In our breed, line breeding is a really wonderful tool. It enables us to set a type. You breed on a common ancestor that had a lot to offer, and we're going to see some pictures in a few minutes that'll show you kind of where we were going with that. And you will get a consistent type, where you get 4 and 5 and 6 champions in a litter. And in my breed, that's previously not been very common. I know in some breeds it is. In my breed, it's not. But we were able to do that because we had a consistent type. There was even an infamous incident where someone accused us of switching dogs because they went from one class to later another show. They were 2 sisters, but they looked so similar, people swore they were the same dog. So, of course, we had to trot them both out together. You need to think about genotype and phenotype. Genotype is what your pedigree is, what your dog has genetically to offer. Phenotype, what does your dog look like? Do you need a better shoulder? Do you need a shortened up loin? Do you have long hocks? Think about what you need there. What we've found to be very successful in our breeding program is to have a tightly line-bred animal and then use an outcross breeding. By doing that, I think you get enough genetic diversity that you don't run into health issues, but you still maintain that type that you're looking for. A lot of people in some breeds like to do inbreeding. It scares the Jesus out of me. I know that in the old days, before we had the tests and whatnot, it was useful for proving a pedigree. There are still people who do it. Some of the pedigrees and some of the German Shepherds are somewhat incestuous. I don't do those breedings, but I will confess, I call those people up on the phone and I say, hey, what did you get? Because then I know, is it safe to go to those other animals for breeding, or do they have problems lurking? And again, there is no perfect dog. The key is not to double up on the problems that might be out there. And here's the big one. If you're going to be successful, you cannot be kennel blind. You cannot. And it's hard, because we love our dogs. We wouldn't be doing this if we didn't love our dogs. And these dogs snuggle up in bed with us, they lick our faces, they're what gives us joy every day. So it's hard to look at that animal and say, she's probably not good enough. I mean, that is hard. But, if you want to have a consistently good program, you have to be brutal. And it's been the downfall in my breed of many programs that were otherwise, started out to be really successful. Time went on, a couple of different ways. We had a fabulous German Shepherd breeder who had wonderful dogs. I always knew, she had champion after champion, and her dogs did everything. She had beautiful breed dogs. She had dogs that worked on police forces. I knew that I could always send someone to her for a good pet. And she was, as I said, very successful in the show ring. But in the show ring, you always want more. And the next thing you know, she was getting a little bit lighter eye. And then there were some that hooked their tails a little bit. Then there were some that had a little bit of a digestive problem. And it just kept going on. And we bought a bitch from her that was a beautiful, beautiful animal. And I had her a couple of weeks, and I realized her poop was really kind of gray and gassy, yucky. And I called her over the phone. She said, oh, just give her Biocase. This was 15, 20 years ago. Oh, just give her Biocase, that'll fix it. So I did that for about a week, and I thought, do I really want to have to put an additive in this dog's food so that it can digest its food? Is that where I want to go with my dogs? And I said, no, probably not. So I sent her back. And I'm really glad that I did, because a few years later, the bitch had perianal fistulas because her bowel movements were never formed. And they amputated her tail and blah, blah, blah. Well, this woman, she had had these beautiful dogs. In the space of about 6-8 years, she had dogs that had more flaws than they had virtues. She'd get the occasional really beautiful dog, but most of them were dead by the time they were 5 from bloat. This last dog she absolutely adored, dropped dead at 3, broke her heart. She got out of dogs. I think it would have been a lot better if she had just not gone down that slippery slope. They were good examples for me. We've been very fortunate. We've shown for many of the top breeders over the years. And literally, I know where some of the skeletons are buried. So for me, it was a little bit easier because I sort of knew, don't go there. But I have a three strikes you're out rule. Maybe this could be a little off or that could be a little off, but come up with 3 and they're done, and then they go to a pet home. And sometimes a person has deal breakers. For me, deal breakers are things that impact that dog's ability to live a comfortable life in a companion home. In German Shepherds, for me, that would be megaesophagus, because I had that horrible experience. Ununited elbows, because a dog can't live in pain and they can't shake. A dog with mild to moderate hip dysplasia is going to lead a pretty normal life. They shift their weight to the front, they get along fine. Dogs with bad elbows, they're miserable for the rest of their lives. They can't shift their weight. They're pretty much done. Seizure disorder. I have people tell me, oh, it's not that big a deal, just they can have peanut butter. I know the first time I ever saw a seizure dog, I was freaked out. I can't imagine that happening in a pet environment with little children around. And got temperament. A dog without good temperament is not going to be happy to be alive, and temperament is hereditary. Some of it's environmental in how we raise our dogs, but a lot of temperament is hereditary. And so is fertility, in my opinion. A lot of us as breeders, we're searching for that perfect dog. Excuse me. And we get this one we think is great, but it has very small litters and we have to do crazy things to get it pregnant. Next thing you know, you breed that bitch. And she has an even smaller litter, you can't get her pregnant at all. Sometimes you have to take a step back and go back to having a fertile dog. Otherwise, you breed yourself into nothingness. And we're back to the whole can't be kennel blind. So now you're going to evaluate your litter. And hopefully you've got this wonderful litter of happy, healthy puppies that are perfect. If you're lucky and you've got enough friends that will help you out, or an extended family, you can keep several. Grow them up enough to know what you really got. Jim hates it when I do that because then I want to x-ray everything at both ends and I want to wait till everybody's teeth are in and he's asking me, do I know how much all this costs? And I said, that's okay, honey, you can pay it. But if you can grow them up and see what you got, that's good. If you can't and you have to place your puppies, follow up. Call your new owners. If you've got a good breeding program, you don't have to be too afraid. I know in the beginning with me, it was like, I almost didn't want to call because it's like, oh God, I'm going to hear about this or that or whatever. But if you're moving in the right direction, and even if you're not, you need to know. So follow up. And follow up on your dogs. So you've gotten this imaginary, nice bitch that you started with as your breeding animal. Check out what happened with her siblings. The internet is a wonderful thing for that. It used to be you had to rely on friends and hearsay, but nowadays you can get online and find out pretty much anything you want to know. But the trick with that is, we have a good friend that shows for us, Ken Boyles, and some of his animals are of similar breeding to us. A lot of times Kent does breedings with animals that are my dog's siblings or cousins or something. And I'll call him up and say, hey, what'd you get when you did that? Or what did you get when you bred to so-and-so? And, if you find out, I really like the puppies, I got great forehands, but we got missing teeth. Don't be afraid to ask. We should be helping each other. That would be the key to being successful in breeding dogs. Find a group of people that you know and can trust and share information. And it doesn't mean, I hate this or I hate that. Be positive, but share information. Because it doesn't mean that that's a bad dog. It just means maybe you won't breed the dog. Maybe your bitch, that the one bad thing about it was one of her siblings had a missing tooth. Well, so you're not going to breed to that dog but it's a tool. More knowledge is always a good thing, in my opinion. So, I guess that's about it for me. What do you think, Mr. Moses? So this was Manhattan. He's the top-winning male in the history of the breed. The Portuguese water dog passed him? I've been at specialty shows and at home with Captain Crunch. I didn't know that. Oh, I hate that. Although I will say that when I first saw that dog, I saw that Portuguese water dog. I'm sure all of you'll know. I was at this little dog show a couple of years ago, and I was walking through, and all of a sudden my eyes focused, and I said, "Holy cow, who is that?" I went, "Oh, hi," you know. And I called Joe on the phone that afternoon. I said, "Oh my God, I just saw the most fabulous dog. I mean, just knocked my socks off." And he's, "Oh yeah, I know." But no, our 2005 Quaker Oats winner is 14 and is unspayed and had an issue with some adenomas, and she had 3 paws. By the time she was fine that night, the next morning she had 106 and was trying to die. She had 3 paws in the grave. I was bawling hysterically because she is my best friend. And anyway, we got to the vet, and he said, "Well, you know, everything else, her blood values are good, her chest is clear, blah, blah, blah." So we did surgery, and she's now chasing me around the kitchen for cookies still. But that was going on, and then Captain Crunch, that most of you know, that Jim's last Westminster winner, with the soccer ball, blew out his T1 and T2 somehow, and he had to have spinal surgery, $11,000 later. And we were carrying him out of the house for a month, but he's up and running around with the soccer ball again, so that's all good. But I've been a little out of touch. That's where I've been, Mr. Moses. Mr. Moses has probably been hunting. Okay, so this was Hatter. He's no longer number 1. He's the number 1 German Shepherd male. I guess he's the number 2 male dog of all time. This is Dallas. Dallas is the number 1 sire in the history of the German Shepherd breed. He was a moderate dog. He was a good mover. He was an exceptional character. He was a beautiful dog. And when I say beautiful, I don't mean pretty. He was noble. He was handsome. His temperament was absolutely to die for. And he was exactly what our breed needed at that time. Our breed had gotten into a bit of a pickle. We had a whole lot of good movers and not a whole lot of attractive dogs. When I say attractive, pretty isn't everything. But I don't know about y'all, but I sure like to look at something that makes me smile. And Dallas was a tremendous sire for our breed at that time. You know, he improved type, he improved character, better feet, better color, better heads, better underjaws. You know, we were having a real problem with dogs that looked like sharks from the side. And Dallas was not anywhere near as extreme as he looked in that picture. When we first got him, to show us a special, his photographs were substantially more foursquare. But we taught him to drop his butt, so he looked a little fancier. And some of the earlier pictures aren't quite so good, but this has always been one of his favorites, so there it is. This is Valley. Valley is the top producing dam in breed history. Now, Mr. Moses may not like this, but I will tell you she had a level bite. Yes. Which is probably why, when I was placing dogs, she went to my friend. But she was a lovely animal. She had a long neck. Her shoulders don't look so good in this picture, but they were actually really pretty. More to the point, her siblings had beautiful shoulders. And when we bred her to Dallas, and you'll see some of the puppies here. Well, that's not actually okay. In a minute. This is a Dallas son. His name is Aries. We call him Bailey. He is the number 1 living sire in the breed. His mother was one of Kent's bitches, and one of those Franjo bitches that we got to breed to Dallas. She had tremendous shoulders, really good body style. She was not particularly attractive, but she had the structure, the basic underlying structure that we needed to give us a little bit better side gait. That is what we need in our national specialty. And this dog has certainly been able to produce that. That dog was the first litter. There were only 3 puppies in the first litter. I think we bred a little late. All 3 finished. The second time we did that breeding, there were 6 puppies in the litter. There were 6 champions. One of them became the number 1 dog all breeds in Canada. And when you do a breeding that's quality, and again, Dallas had quality litter mates. He was a Grand Victor son out of a Grand Victor's daughter, out of a Grand Victor's daughter. Grand Victor is the title for the winner at our national specialty. There were 4 really, really, really nice animals in this pedigree, and in that litter. Then the breeding of this dog's mother, I think Kent did that breeding 3 or 4 times. Quintessential, his mother produced Bailey and many other, all those other champions. One of her sisters, Quinella, produced a dog named Antonio that was also a national specialty winner. The puppy that we just won the nationals with goes back to one of the other sisters. So again, when I tell you look at families, don't just look for a star. Don't just breed to a dog that is a star. Look at a family of dogs. This bitch is the #1 living dam. And you know, when I said to you, don't be so hung up on being kennel blind. This bitch is not our breeding. She's one that we actually were cutting back by the time we acquired this animal. We had some beautiful, beautiful type E animals. We had a lot of winners. We were having a little bit of an issue with size. And you know, you have to be true to your standard at the same time. Sometimes you want to win. Our standard calls for German Shepherd bitches to be 22 to 24 inches at the shoulder and males to be 24 to 26 inches at the shoulder. Dallas was probably 25 and a half, 26. But frequently in a specials class, he looked small. And Valley was, a very feminine, probably 23-inch bitch. So we didn't necessarily have the size, particularly, in some of the males, to be as competitive as I wanted to be. We won, but I wanted more. So I had seen these dogs, and the problem with in our breed is when you get oversized, frequently they lose quality. They start to look like giant dogs. They get round bone instead of oval bone. They get floppy flews. They get sponginess. They lose their athleticism. This particular breeder, I had seen this dog's mother at some shows, and I wanted him to buy her for me. But she had an overdone kind of hindquarter, and he said, nah, it's too much hindquarter, too much for him. So this one of them said, well, I'll just keep her then. And she brought her herself and produced this bitch. She's a biggish bitch. And her brother's a Grand Victor. I think they have half a dozen champions in this litter. The thing was, Jim said to me, why do you want this other dog now? I thought we were cutting back. And I said, well, I do, but she has what I want if we're going to keep breeding. I'm not, it doesn't have to be one of mine. I'm not shy. I like your dog. Hey, can I breed to it, or will you lease it to me? Or, I want to incorporate that in with what I have, because I think you have what I need. And he said, well, what do you think? And I said, well, they've got the size, they've got the side gait, they're handsome but elegant. It's got everything I like. And I said, we need the size. And I said, we're getting sick of these 50-pound bitches. And he looked at me and he said, well, I don't mind the 50-pound bitches so much, but I sure hate those 60-pound males. So we got this bitch. And now she's the #1 living bitch. Let's see if I can put it. Oh, okay, so back to Dallas and Valley. This is Genuine Risk. She had 100 best in shows. She was OFA excellent and lived to be 14 and a half. It's her younger sister, Geneva. She's the 2007 Quaker Oaks winner. Another sibling. Her sister, Gracie, also OFA excellent, just died at 13. Yet another sister, best in shows, select 2 at 7 years of age, which for our group is pretty big. Oh wait, I'm sorry, I'm thinking I'm going to leave and I'm going to try. See, they look too much alike. I thought I was looking at Little Eve. Yeah, this was Silver Charm. She was selected in both countries. She's a best in show winner. She was, at that time, the youngest herding title German Shepherd. She was 11 months old and got it with an extra leg at her nationals. Now Little Eve, who's also a best in show winner and select. This bitch just died 2 weeks ago, a week shy of her 15th birthday. So, you can have these things. These are all animals that are dual titled. It's possible, but you have to try. If you find that, if you've got, and I'm going to say to you, Some of the times, even now, we've got sort of two lines of dogs going forward right now. One line, they make great show dogs, but they're not easy to live with. And I say not easy, I mean, they're all right, but they're a little sharper than what I would like. They're a little more high-strung. They're not shy, but they're not as easy for your average pet owner to manage. So, to be frank, I've placed them all. They're winners, but not where I want to go forward. Now, this bitch is actually, let me go forward one more. This is Valley's sister Blondie. Valley was not only a top 20 dam of all time, she was a top 20 performance dam of all time. And that's one of her children. Another OFA excellent. She was the high scoring dog in our national specialty in herding. This is another of her children. This bitch won the group at Bucks. She was selected at the Canadian Nationals. She had 11 agility titles. And in her first litter, that's the mother of Aries. When I said she wasn't really attractive, but she did have really good shoulders. And gave us sort of what we need there. Another one of our dogs, Bronson, a Bailey's son, gave us the side gait that we were looking for. Really superficial eye appeal also. Beautiful eyes, beautiful coat. Really, really hard back. A lot of German Shepherds are a little too long and a little soft in the back. And this dog is really what did it for us, and I've continued to use him in our breeding program because of that back. And again, you hear me talking about this, we're like taking bits and pieces of different dogs, trying to maintain the same overall look, but trying to compensate. As you see what you need, you look for something else. Try to bring that in and fix what you need. Don't just keep going where you're going. If your dogs are starting to get long, do something about it. Don't just let it keep going on. Or if your dogs are too short-legged, or if they're too, whatever it is that you have in your breed, if you have to be brutal, look for what your problems are. Try to stop them before they become absolutely set in stone. This is a son of the bitch that had the agility titles, sired by the dog that you just saw the picture of. Where she fell short a little bit was in her forehand and her top line. This dog, we bred her to Bronson, and this is the result. He was Futuri victor of our nationals, and 3 times selected our nationals. It's another one of the Bronson sons. This is Katerina. PAM stands for Performance Award of Merit. I don't know if it's an obedience title or if that's something that our parent club does, but basically it means they took title in 3 performance events with an excellent in at least 1. But again, she was a pretty type, but she could move, and she's got a brain and she can work. Now I will tell you, I think she's beautiful. She floats my boat. Her hips didn't pass, and they were not close. And she's spayed. We're about to be. This is a young dog that, and you know what, and sometimes we don't know why that happened. I'll go back to her. Her mom's OFA excellent, her dad's OFA good. It's a pretty solid pedigree, but sometimes it happens. If she had been the only animal that was that way, and if it had been really close, I probably would have bred this bitch. She had good elbows, she had so much else to offer. I probably would have bred that bitch, and I would have, to the best dog with the most clear producing hips I could find, and I would have kept them all until they were 6 months old while Jim moaned and groaned. But he lets me. He just likes to fuss. And I would have x-rayed all of them. And if they were all clear, that would have been okay. As it happens, she had a sister that didn't pass either, even though she went select in both countries. So neither one of them was a breeding animal for me. This is a young dog that we love, really love. He's got wonderful temperament. He's got a beautiful type. He's a good mover. He is the best dog, just the best to be with. And see, now I'm a breeder. Here I am. Can you see me smiling? But Jem thinks he's a little on the small side to be competitive, which means he's probably a half inch oversized. Yeah. like I said, he's probably a half inch over the standard, but in our venue today, he's probably on the small side, because he's correct. Anyway, to a certain point, you have to breed to what makes you happy. I'm at a point in my life, you know, there was a time when I wanted that next champion. I'm at a point in my life where I want a dog that makes me happy. I know what my standard says. I feel like I know in my heart what's right for my dogs. And I'm going to breed dogs that make me happy. If they win, good. If they don't win, I don't really care. I'm taking my dog home. Now, if I really respected the judge that beat my dog, I'd have to look hard at my dog and see if I was falling victim to kennel blindness. But I don't think so. This dog was Grand Victor. Now, this dog is one we bought. His grandfather is our dog Bailey, Aries, but the rest of his breeding is a total outcross. We bought him, actually Jim bought him, to breed to our Bronson daughters. Bronson was, again, a very outreaching dog, but you know, we needed a little something. Jim saw this dog and he said, hey, take a look at that dog, what do you think? He'd be perfect for our Bronson daughters. He was about 10 months old, I asked what his pedigree, so he looked good. I asked what his pedigree was. Oh great, his grandfather's one of mine? Perfect. So we bought the dog. And as it happens, he made a pretty good show dog. He's the top winning specialty dog in our breed history. He's a grand champion. He won both nationals. He's herding titled. He's always been excellent. CHIC. This is a Liberia's son. Oh, and by the way, the dog that I was so fondly reminiscing about, saying how much I love him. His mother is that black bitch that is the #1 dam of all time, our #1 living dam. And his father is our Bronson dog. This dog is out of Aragon, the Grand Victor you just saw, and the same black bitch. That's my house bitch, Tina, the one recovering from surgery. And you know, when I look at a German Shepherd, when I look at a dog, whatever breed, you know, we have other breeds also. I want that dog to please me when I look at it, and I have it sort of a thing set in my mind what I want them to look like. And this one just fills up my eyes and my heart. I think that's kind of what our breed's about. And then this should have been one up, but I'm going to show it to you. And you can't keep them out of the ring, can you? When you love your dogs, Mr. Moses wasn't happy with the handler that was presenting at the time, and he said he could do this himself, and off he went. I think that's the thing as breeders. You know, we love our dogs, we love our breed. We're trying to do the best that we can. Just sometimes we got to think about it.
Thank you all for coming. We have 60 seconds if anyone has any questions. Thank you all for having us.
You're not escaping, you're going to be a part of the panel. Let me just change the next program and we will have Mrs. Bowes. Sharon, did you take my papers underneath here? So, for our ending presentation prior to our panel discussion, we have a presentation from Mrs. Ann Bowes, who purchased her first Pembroke Welsh Corgi in 1968, bred her first litter in 1970, always maintained a small number of dogs, never housing more than 6 to 8 adult corgis at any one time, and averaging 2 to 3 litters a year. From that number, I bred 93 Pembroke champions and 5 Grand champions, the large majority of which were breeder owner handled for their 2 titles. Bred 2 PWCCA National Best of Breed winners, multiple Best in Show and Best in Specialty Show winners, multiple group winners, group placements, and my dogs have competed in performance and companion events and are title holders. 2007 AKC Herding Group Breeder of the Year, an active member of the Pembroke Welsh Corgi Club of America, serving on the board of directors over 30 years and 2 terms as president, currently serving as the AKC delegate. Active member of the Ladies Dog Club, past president, and has served on the AKC's Breeder Education Committee, current member of AKC Delegate Parent Club Committee, and AKC's Judges Review Committee. And was the judge of the Pembroke Welsh Corgis for 25 years, has judged Pembroke's for the PWCCA National Specialty twice at many regional specialty shows around the U.S. and in 7 foreign countries. And is also approved to judge Shelties, Cardigans, Pugs, Juniors. She's judged at Westminster, and will learn quickly that she is a teacher of whole breed handling classes and seminars on handling, breeding, raising, and training dogs. We welcome Ann Bowes.
Thank you very much. I'm so glad you all are here. I think dog breeding is the most fabulous thing you can do. I walked down to the grounds of a dog show absolutely by luck one day in October of 1967. It was Oxford Kennel Club and showing in Darien, Connecticut, and I was riding a horse at Oxford Hunt Club. And in the morning, and I said, well, what the heck are all these tents out here for? And they said, oh, they're having a dog show. I said, a dog show? They actually show dogs? So I rode my horse and hurried home and changed my clothes and came back. I walked down to the grounds of that dog show and into the rest of my life. I knew then, when I got there, that this is what I've always wanted to do, was raise, train, and show dogs. I just did it. As soon as I found out they did it, I was there. I think dog breeding is, without a doubt, the best profession on earth. You hold that puppy in your hand at birth, you raise it, you train it, you love it, you send it off to its forever home, or you keep it and show it, and then breed it, and it gives you joy for the entire length of its life. If we do it right, this is the only profession where we can sell love. I don't know anyone else who can say that. But we have to do it right. That's the important thing. And I believe that early puppy training is a tool to help us do it right. Someone once said the best way to predict the future is to invent it. And to say it a little different way, I think the best way to predict your puppy's future is to train them. I'm talking now about early puppy training that starts from birth and up to about 12 weeks old. That's about the time when my puppies go into their new homes, anywhere between 10 and 12 weeks old. So this is the time frame that we're going to be talking about today. Only the breeders can do this training, because we're the ones that are there with these dogs, with the litter when they're first born and growing them up. We're the ones watching them. We're the ones spending the time with them, and we're the ones that can turn that time into something that is really valuable for them. Now, I do have to start with a little disclaimer. Unfortunately, this presentation, you're only going to see corgi puppies doing these little things, going through the little training. That's not because I think they're the only ones that can do it, or that they're the smartest breed that there is. Well, maybe I think they're the smartest. But so I want you, when you're watching this, I want you to put your puppies in there and watch them doing these things as we go through this presentation. Okay, so I believe that whether you're raising puppies for conformation, for companion events, for performance events, or for just wonderful family pets, any breed any breed, can benefit from a program that I call Head Start for Puppies. Now this is early puppy training, and I mean early puppy training. If I could figure out how to train them before birth, I would do that. If anybody does figure that out, would you let me know? Because I would like that. But I start right at birth, and I think breeders can utilize the time that they spend with their puppies to teach them very important skills. Puppy training can be started very early, much earlier than I think a lot of people think. Young puppies learn extremely quickly, and when they're trained as young puppies, they will learn as older dogs even faster as well. It's because we're developing their brain and we're giving them stimulus, and their brain is then able to take in much more as they grow. The time you spend with your puppies can really make a big difference in that puppy's future. Okay, the first thing I like to do is bond the puppies to me. As soon as they are born, in fact, in the first 5 minutes that they're born practically, as soon as we get them breathing and going, I pick them up and I cuddle them to me, get them to smell me. Now they're born, obviously we all know they're born blind and deaf, but they can smell. So that's the first place where you're going to start to bond them to you, is have them smell your smell. The first time my puppies eat comes from me. I bottle feed them first, even before they start nursing on their mother. So the first food that they get comes from me and the way I smell. So that is what helps form this really incredible bond between me and my puppies. I handle them frequently. I know some people feel they shouldn't handle young puppies. I handle them all the time, and snuggle them a lot so that they can get a lot of my scent. Name that puppy. I'm a very big believer in naming puppies immediately. My puppies are named within 2 to 3 days after birth. I have a theme for every litter, and when we sit there watching the puppies at first, a friend of mine and I would go through the theme, and then we pick all the names of the puppies. I think it is very important to name the puppies, because that way you can start teaching the puppy their name. Now, I understand they can't hear you at first, but if you keep saying, picking up each puppy while you're snuggling it, keep saying its name, it's amazing how fast it can learn its name. At the moment, I have a singleton puppy, so he didn't hear anybody else's name but his. And he really, at 4 weeks of age, he started responding to his name, which I think is pretty interesting. Not only do I think it's a good idea for you to name the puppies for the puppy's sake, I think it's a good idea for your sake. Because instead of looking at a litter of puppies and saying, all right, well, this is Tootsie's litter is doing this, and Tootsie's litter is doing that. In other words, looking at them as a whole group of puppies. You start talking about them as individual puppies, and that starts you individualizing them, and then they learn that they are not just one big part of a litter of puppies, they are an individual dog, and I think that's important. A lot of people breeders say that they're not going to name their puppies because, oh, why should I name them? The owner is going to change the name later. Yes, the owner can change the name later, that's fine. I name them, and then at about 8 to 10 weeks, when we decide that some puppies are going into the pet home and they have their name, I just change the name for them before the puppy gets in their home. So that is not a difficult thing to do. Then I start shaping behavior. Training very young puppies is all done by rewarding desired behaviors. Obviously, you can't, think of any kind of punishment with a 3-week-old puppy. So all we're doing is shaping behavior. One of the first behaviors I like to shape is a response to the word cookie, cookie. That's the word I use. My breed, as you probably know, is shown hands off in the breed ring. So they're trained to stand and bait on me. We don't do a lot of holding up with the head and the tail. We don't have tails, so we don't get into that. We don't do a lot of hand stacking in the ring. The Pembroke Welsh Corgis are shown pretty much hands off. So I like to teach my puppies right away a word that gets them to focus on me and not pay attention to what's going on around them. And this is good for not only conformation training, but it's good for any kind of training that you want to do. And this is just an example of some of the things that you can do. Once they start eating on their own and their little puppy pan, they're all eating there, I repeat the word cookie, cookie while they're eating. So they start to realize that the word cookie, cookie is also associated with food and associated with something good. And then I teach them later. I started handing them food from my hand so they start focusing on me. From the time my puppies are born until they are 4 weeks old, they're in a very quiet situation. They're not, there's no other dogs around them except their mother, so they don't hear the other dogs coming and going from the kennel. They're in a very, very quiet situation. I think it's important, particularly from week 3 to week 4, to keep the puppy as quiet as you can. That's when their ears are opening, their eyes are opening, there's a lot of stimulus coming to them, and it's good to keep them quiet for at least the first half of that week. So by the time they're about 3.5 to 4 weeks, that's when I start to move them. Then I move them into my kennel. I have a puppy room in my kennel, and that has a table and a mirror, lots of mirrors, and the pens all set up for them, and everything is set for them. But it is in my kennel, so then now they're going to start to hear the dogs barking, and they're going to hear all that kind of stimulation that I think that is best to wait till they're 4 weeks old for that. While they are running around my kennel room, what I'll do is at 4 weeks, start at 4 weeks, I take each puppy up individually, keep repeating its name, stand it on a table, and look at it in a mirror to see what the conformation is. And because I am interested in showing them in conformation, so I have them all teach them to stand first. If I know already that one of the puppies is definitely going to be a pet, either we have things in our breed that at birth we know that they're not going to be able to go in the show ring, either if they're long-coated or mismarked in some way, then I'll teach that puppy to sit starting right away. But basically I start them teaching stand, I check their bites, open their mouths. Even dogs that are going into pet homes, they have to have their mouths open. The vets always open the dog's mouth, so they have to learn to do that. And I also obviously check for testicles, which I'm worried about testicles anyway, so we start checking early. Now, as again, if I know that the dog is going into a pet home, or if you're out there, you're raising puppies for obedience, then I would say it's very important to start teaching the dog to sit at 4 weeks, because they'll be on a table, you can get them to sit absolutely square. And puppies learn what they repeat. If you start them out sitting absolutely square, that's the only way they're going to know how to do it. And when they get older, that's what they're going to be doing as well. They'll still be sitting nice and square. I also use the table. I teach them down and down stay. And then I also start at 4 weeks, all the dogs, whether they're going into pet homes or they're staying with me, I teach them how to come when they're called. Coming when they're called is probably the most important thing you can teach a puppy. I start teaching them at 4 weeks. And that's by imprinting. You know, like the mother ducks imprints the ducklings on her, I try to imprint these puppies on me. And one of the ways I do it is I take them out into, I have a big fenced-in yard, and I take them out in the big fenced-in yard and walk away from them. And they're like, oh, where's mother going? So they come along with me, and I call them to come, and that's the first way I start teaching them. Also in my puppy room, I'll drop a few little kibbles in one corner, and then I'll go to the other corner, and I'll call them over to me and put little kibbles down that corner, and pretty soon they're learning to respond to the word come at about 4 weeks of age. I'm always amused at a dog show when you hear the word loose dog, and this is dog, catapulting through the building or through the rings. I think, why didn't they just call it to come? why didn't they just teach to come? That would have been so much easier. Any dog that you're going to do anything with, if it's trained to come when it's called, it's certainly a great advantage. Now, then we come to about 8 weeks, and we start out the sorting process, okay? Which dog is which puppy is which. I'm always hoping that I don't keep the one on the top, and I don't sell the one on the bottom. This is the problem. It's difficult in many breeds sorting out puppies at an age young enough so that you can then get the ones you know you don't want to use in your breeding program into a home while they're still young enough to, a family can enjoy the puppy and the puppy can also bond to the family. It's difficult. My breed is not a breed where, what you see at 8 weeks is what you're going to have as an adult. I don't know if any of you breed breeds like that out there, but certainly my breed is not that way. But there is one thing that you can tell at at about 8 weeks of age in our breed is the basic genetic temperament the puppy has been born with. And that, I do this through temperament testing. And what we do is we arrange this so that when my puppy is born, when my litter is born, I send out a notice to all my breeder friends and say, we're going to have a puppy test at a certain time, so that they all come. We like to invite new breeders as well to see this. And I have one person who temperament tests most of my litter. She's pictured there, her name is Joanne Baker. She's temperament tested almost every litter I've had since 1984. I've temperament tested every litter I've had since 1980. And I used the test that was developed by Wendy Bohart in the 70s. So it's a test that has really stood the test of time. And it's something that I've been able to really use all these many years with very little change. The only problem is the test does talk a lot about tails and how the tails do this and the tails do that. So we've had to, look beyond that part all these years, because obviously we don't have tails to look at. But if you are temperament testing a breed with tails, it is really even more helpful. So at about 7 to 8 weeks of age, I run the puppies through a series of 10 tests, they're not designed to be a pass-fail test at all. They're just designed to kind of give you an idea of what the puppy's temperament is. The test is administered by a stranger to the litter, so Joanne has never seen the puppies before she tests them. They are tested in an area of my home that they have never been in before, and it is the first time that they are ever alone. So I don't separate the puppies. I mix them up a little here and there in different pens, but they're never alone until the moment of the temperament test. So, oops, what happened to my temperament test? It's not in here. Oh dear. This must be the old, where's the paragraph? This is the old one. This is not my new one. This is not, I'm sorry, this is not my new, Kristen and I worked on this temperament, on this PowerPoint, and I added 4 slides. Sorry. Oh, does anybody have any questions so far? Sure.
As far as the early training, my breed is Smooth Dachshund,
Okay.
and I want to make sure that my puppies, when I hold them looking at me, that, when as they grow, they won't be upset being in that subservient position. Do you incorporate those types of, do you do any of the, let them 3 seconds upside down, with the looking at the puppy, and like the ones I box them?
What age are you talking about? What age are you talking about?
I'm talking about from 3 days old.
Okay.
We take our puppies and we make sure they're on their back. The ones I dog feed, they are so short to so hard to work. Everything they do. I say yummy, yummy. The puppies come running to the bowl.
It is very simple, yeah. That's
I've got
right.
2 litters right now. One litter, I didn't have to dog feed anybody. Those puppies are so much further along. My puppy that I had to do some modification. Made all the difference in the world. But what I want to know is, as far as that subservient position, in other words, lay them on their back, where they are looking at me, and I'm looking at them.
Oh, yeah, okay. But just to answer your question, up until 8 weeks, I just mostly, especially when they're very little, I just stumbled them. And then later in the testing, we do some down training and some teaching them who's in charge. But I don't do it that way. No, I don't for mine. Okay, so here we go. Here's the temperament testing. Can you read that? No, I was afraid of that. That I was afraid of. That. I wasn't afraid that it wasn't gonna be there in the first place. That's all right, well, all right, I have copies of this test for you, if you're interested in it, afterwards you can come up and get it. But, so I'll just read it quickly for you. The first test is social attraction, and basically the tester gets down on her hands and knees and calls the puppy to her. I bring the puppy in, put it down on the spot, and the stranger calls the puppy to her. Then the second one is following. She gets up and walks around and see if the puppy follows. The third test is restraint. This is what's happening here. On the top slide, that is restraint. She holds the puppy down for about 30 seconds, a count of 30 seconds. And then, I'm going to go back to this, then she lets the puppy up. And what we love to see is a puppy who says, oh, I hated being down like that on my back, but I'm going to forgive you. This is one of the most important tests that I find to see whether these corgi puppies will be able to go into a home with young children. Because young children do things that are very inappropriate to puppies. And you want a puppy that's going to say, they do, and there's nothing you can do about it. You want a puppy, if you have a family with young children, you want a puppy that's going to say, it's okay, I didn't like it, but it's okay. I love you anyway, so that's what we're doing. When I go into the test, I tell Joanne, oftentimes I have people waiting for the puppies, and I'll tell her, okay, I've got a home with young children, I've got a home where the two adults are going to be working. I tell her the different homes that are waiting, and I tell everybody who's in the room what the homes are that are waiting for these puppies, and then we go through the test and kind of say, oh yeah, well this one would be better for that, or this one would be better for that home. So that's what the important thing is. Okay, then after we do the restraint, we do social dominance, which is the bottom picture there. We're holding the puppy up just off the ground and see how he does. Now, unfortunately, my puppies don't really respond to this because they've been picked up so much between the time they were born and the time this test is taken that they don't really respond too much to this test. It's not actually one of our better tests. We use it to take the pictures because they look very, very cute. That's called elevation dominance. That's where we hold the puppy off the ground. Supposedly, you want to see how the puppy responds when he's out of control. Okay, now this is the next slide, which you also probably can't read either. Retrieving, the bottom slide there is the puppy retrieving a little piece of paper. We throw that out and see if it will retrieve. It's amazing how many puppies will. This is one of the things that we use to determine whether this is good obedience, a prospect, a good training, a dog who really wants to work for his owner and is interested in training. We do touch sensitivity. We take hold the puppy and put our fingers between the pads and count and see how many counts before the puppy cries. It's very important. If you've got a puppy that you're putting in a home with young children, you don't want a puppy that's sensitive to touch. And some of them are. Pembroke Welsh Corgis were actually bred to be sensitive to touch because they were bred to, and sound, and sight, because they were bred to be herding dogs. So this is something that I have to test for and think about. Sound sensitivity, we bang a pot and see how they respond. Chase, we put a towel down and drag the towel across the floor and see what their chase reflex is. This is to decide whether you have a dog that would be a good candidate for herding trials. I personally am trying to breed out the herding instinct in my dogs, and I laugh about that. Some of my fellow breeders don't think that's too funny, but here's the thing. Most of my dogs go into homes with children or family dogs, and a dog that has high herding instinct and really a high chase prey drive is not a dog, especially for young children. So this is something that we test for and we look for. Stability. Stability is the top slide there. We open an umbrella and set it down. This is something that the puppies have never seen. And when puppies go to dog shows, they're going to see things they've never seen. So I want to see how they respond. Now that little fellow said, oh, yeah, look at that. So this would probably be a good prospect. Another thing that we do is that we decide what the energy level is of the puppy. Now even though you can't read it, you can see this up here. We have a score, and the scores have different descriptions to them for the score, and that's how we score it. And then on the actual page, there's a column there where we put comments. So we do write comments because some puppies don't fit in exactly to the score, so we want to see, you know, how we put down comments. I keep all these pages and I refer to them later because sometimes an owner will call me up and say, oh, you know, my dog is this or doing this, and sometimes I'll go back and say, well, you know what, I understand that because the dog showed this kind of a tendency on the temperament test. Here's what I recommend that you do. Then after the test, we bring all the puppies back into the room because now I want to pick my star. That's what I'm there for. I want to pick the dog that I feel is going to be the best, maybe temperament on the day, and that doesn't mean that I don't change my mind later, but on the day, the best temperament for the show ring. And because that's what I'm doing. And then we stand them on the table, and I have all the breeders there go over them. As I said, a lot of times we have young breeders, so we're teaching them what to feel for on the 8-week-old puppy. And then we often say, well, you know, this could change, or this might not change, and it's been our experience that, you know, if you have this at 8 weeks, this is maybe what you're going to have. But so that it's a learning experience not only for me and watching my litter, but also for the other people there. One thing I forgot to say is that during the test, I'm not allowed to say anything. Yeah, I have to keep absolutely silent, which if anybody of you know me, it's not very easy to do. But it's good for me because I have to stay silent and really watch how these puppies are responding to the tester. And then that gives me some ideas. I mean, it has happened over the years that a litter of puppies, I had no idea which one, you know, I had my eye on one, and then another puppy came into that test and just blew me away, and turned out to be one of my best show dogs. So that can happen. I love that when it happens. One of the things I do with each person there before they can go home, I say to them, which puppy would you take home today and why? And that sometimes that helps me because I've seen them every day since they were born, but they're looking at them for the first time. And a lot of times the one I think is best, somebody else, another breeder, they'll say, oh no, this one, I like this one better, and it turns out that that breeder's more right than I am in the end. So and again, it's another learning experience for young breeders, which I think is very important. You need to bring breeders along and teach them how to evaluate puppies. So after the temperament test, this is when the real work starts. My puppies are trained every single day from the time they're 8 weeks old to the time they go into their new homes. Now, I can't always do it all myself. I hire kids in my neighborhood to help me. Luckily, right now, I have twin girls that live very near me and can walk and love to do this. I mean, you know, get paid for training puppies. I wish somebody had given me that kind of a job when I was this age. So I teach them how to do it, and they do it for me, which is a great thing. The first thing I do is teach them how to walk on a leash. And one of the reasons is because I really can't tell how this dog is going to move, how good a show dog the puppy's going to be until I see how the dog handles himself on the lead. Sometimes you put a leash on and the dog goes, you know, like that. Sometimes you put a leash on and you go like this, you know, and that's it. I mean, we hope we can train them to walk better, but not always. So leash training is extremely important. I know breeders that don't leash train their puppies till they're 4 or 5 months old, but I like to start at 8 weeks and get that going so that I can see how that's going to work. One of my little tips for leash training is the best thing that works for me. There's lots of different ways to do it, but one of the best ways that works for me is to have the pen of puppies outside, all of them in one pen. Take one of them out, walk about 10 or 12 feet away, put the leash on, and walk the puppy back towards the pen. Because the puppy's anxious to get back to his litter mates. And they really don't realize that the leash is on. And then every time you go further and further away and walk them down. That's the way I like to introduce the leash. And then later, you know, we do more with the leash and more individual training as well. We teach them stand for exam, of course, because my puppies my breed is judged on the table. If they are not able to stand on a table while a second person examines them, you know, you might as well forget it. So I start them right away. I start them really at 4 weeks standing on a table. We teach them to free bait. That comes a little bit later. I like to teach them to stay on a table without food first, and then introduce food later. And free baiting, of course, is when they learn to stand on their own on the ground and look up at me. Crate training, every puppy after the temperament test, each puppy is put into its own crate. So there's very well crate trained before it goes into its new home. That's so important for not only socialization, but of course for housebreaking and other things. My new owners always come to get the puppy with their crate, and they're trained on how to continue the crate training of the puppy. It's a lot easier for them if that puppy's already crate trained before it goes to them. Obedience training. Now, if the puppy's definitely going to be either a pet or I have somebody who's interested in obedience, then we really concentrate on sit and down stay. Again, come, still the most important thing you can teach the puppy. Fetch, I also teach them to fetch. I actually teach all my dogs to fetch. The dogs are going into a pet home. If they learn to fetch, it's the best way to exercise them. The biggest health problem in Pembroke Welsh Corgis is obesity, and that is totally owner controlled. So if I can give them a way to exercise their corgi without having to exercise themselves, which seems to be the way most Americans want to do it, then it will help in the health of that puppy later, because hopefully they can keep the puppy a little thinner. Again, with Come Now, now that they're leash broken, I start teaching Come on a leash. I teach my kids to back up and call the puppies to come while they're on leash, always with lots of treats. I am lucky that I have a breed that's very food motivated, and I do use, obviously in the training of young puppies, use lots of treats. I use small treats, usually cat food at first. They love cat food, and it's smelly, and it's small, and it's easy for them to chew. Now, no matter what it is you want to do with your puppies, if you start introducing it now, at 8 weeks, they will be much better at it, no matter what it is you want to do. You want to do field trials, or duck diving, or barn hunts, or tracking, or herding, or anything that you want to do with your puppies later. Think about it now and start introducing them to it. Obviously, this little fellow is never going to have any problems if he goes through an agility tunnel. Tunnels are no problem for him because he's been sleeping in them since he was about 6 weeks old. But it's sort of fun to think up things that you could do with your puppies and introduce them to as a young age. The agility people, they start them on teeter-totters and all of the they have small baby puppy-sized agility equipment. So whatever it is that you want them to do, we can start doing it now. Grooming. Grooming is so important. I see people say, my dog is so frightened of the blow dryer because I never introduced them to it. Well, I think you should introduce any kind of grooming things that your breed needs right away. Because even if it goes into a pet home, grooming is so important for the life of the dog. And if a dog is happy to be groomed, the new owner will groom it more. If the dog is horrified by having its nails done, or being combed or being blown dry, the new owner's not going to do it, and it won't be fun for them. I start weekly nail trimming at birth. My dogs that stay with me, their nails are done every week from birth to death. That's why most of them put up their little paw and say, "Can I go to the vet home?" Because I bet you the vet home's not going to do my nails every week. So I begin bathing them at 6 weeks or sooner if they need it. And I introduce blow dryers first on the adult dogs. I just have the puppies around while the blow dryers are going. And then, because my breed is blown dry at the dog shows. So at first they just hear it, and then as they get older, they go on the table and start to be blown dry as well. Well, okay, so this is a lot of work, obviously. It's a lot of fun. But it's a lot of time spent and a lot of work and money. I pay these kids to help me train the dogs. So what is the benefits of this? Well, first of all, puppies learn what they repeat. And this is what I tell my new owners. Puppies learn what they repeat, and you promote what you permit. My little puppy owners, they go out repeating that when they leave my house. But this is true. Puppies learn what they repeat. And if you just have them repeat just exactly the way you want them to do it when they're an adult, that's all they're going to learn. They're not going to learn the wrong way to do it. So that's so important, especially for new owners that maybe never had a dog before. They're getting a puppy that's already trained, already knows how to do things, And they feel so much more confident taking that puppy home. Also, puppies will be ready to compete early in all the AKC events if that's the kind of thing you're doing. Now, luckily, now AKC has decided to have 4 to 6 month puppy classes at their shows, and I love that. I love doing all the little puppy things because my puppies usually are. They might not be the best one there, but they're usually the best behaved. so often I win early, quick, because they're the only one that'll walk on a leash. You know? Now we have these 4 to 6 month puppy classes so that we can take puppies to shows early. I'm so pleased about that because I think, again, if you want them to go be a show dog and as an adult, you need to introduce them to that early. Introduce them to mats and all kinds of things that have to do with the shows. So, the benefits of early puppy training. They learn what they repeat. Through early puppy training, they don't learn any bad habits. They can be placed in the right home for them. This puppy here was sold into a family, a woman who was very fond of her elderly mother-in-law. And she said, I want a puppy that not only is going to be good for my family, but can go to the nursing home and be good for my mother-in-law, because I'm so fond of her. Unfortunately, this woman has now passed away. But when that puppy was just, they only had it for a few weeks, and off he went to the nursing home, and look at the smile on the mother-in-law's face. That's why I do what I do. They'll make an easy transition into their new homes. First of all, you're going to place them in the home that's right for them because you've decided what temperament is right for that home, and you've trained the puppy to go into that home well. And then they make that easy transition into the home. It's good for them, good for the new owners, and everybody is really happy. Also, the new owners are going to feel very comfortable contacting you in the future for any problem they might have with the puppy down the road. I always say to people, when you buy a puppy from a breeder, and especially when you buy from this breeder, you not only get the puppy, you get me, whether you like that or not. But I think that's something that's very important. And I think if you train the puppies first, and then show the new owners when they come to take the puppy home, what training you have done with the puppy, and even get them to practice a little bit, they feel comfortable then calling you if there's a problem because they know you trained that puppy. You put the puppy together, so if they take it home and it starts breaking, they figure they can call you to help put it back, and that's what you want. You want them to call you because you're the one that knows your puppies the best. You're the one that knows what they do and what they don't do. Not only in behavior, but also from the veterinarian. I've saved my puppy owners really thousands of dollars at the vets when they call me up and say the vet has decided that the puppy has X, Y, and Z, and I'll say, well, you know, I don't think so. My puppies don't usually get that. They might get something else, but so this is the kind of rapport that you want to establish with your owners. Also, the most important thing that a dog breeder can have is an active pet market for the pet puppies. You cannot keep breeding and keep trying to improve your line and keep trying to get that great one to go in the show ring with, or the obedience ring, or the agility ring, whatever it is you're breeding for. You can't keep doing that if you can't sell the pets. So you must, the best asset you can have is an active market for your pets. Big waiting list for those pet puppies. I have a waiting list that's about 12 months old, and I just cut it off half the time because I have so many people that are waiting for my puppies. But that's great because when I decide, like Sherry said, when you said, okay, this one's out of here, all I have to do is pick up the phone, and I've got somebody right there. I look at the puppy, I think of the temperament of the dog, I go to my list, see what they're looking for, call them up, and the puppy goes off into his pet home instead of staying with me to be a show dog, which I've decided that he's not going to be. So that is one of the reasons to do all of this. I think it is so important. So this is a picture of Clarabelle. Clarabelle was 10 and a half when that picture was taken. She won an award of merit at our national specialty at 10 and a half years of age. And she had a fabulous career, winning many specialty best of breeds. She won her grand championship after she was spayed as a veteran, which means that she had to win either best of breed, best opposite, or select bitch at specialty shows that would allow her to be shown as a spayed bitch. So that was pretty difficult. She had a fabulous career, and where she won Order of Merit at last year's specialty at 10.5. This year's specialty in September, she won the Veteran Sweepstakes at 11.5. And we have retired her now. But she would like to leave you with a thought. If she could talk, this is what she would say. Everything she needed to know for this fabulous career that she had, she learned when she was taught. Thank you. Maybe you want a copy as a test? I think I'll just bring it down here and put it on the chair here, and you can pick it up. There's something you think you might use in your meeting program. All right, we have our presenters up here for our panel. Actually, Ann's going to take over moderating the panel. I will. Yes, you can sit right there. I'm good. Okay, so this is fabulous. Look at this panel of people, the expert, the amount of years and time they've had breeding dogs. So this is your time to ask any question that you wanted to ask about dog breeding but were afraid to ask. Here we are. But I'm just going to tell you, we're just going to have a few guidelines, okay? I'd like the questions to pertain to the PowerPoint presentations or any phase of dog breeding that the PowerPoint presentations might have raised in your mind. I think we like questions that are general in nature, not if you have a specific question about your little bitch, maybe that you've had a medical problem with, you would like to ask Marty later, fine. But for this part of the program, just keep them general. Okay, and when you stand up, just and ask the question, decide which, if you want to direct it to one person, that's fine. If you would just state your name and your breed, that helps us a little bit. And then direct it to one person. After that person answers the question, I'm going to ask whether any of the others of us would like to chime in as well. Okay? And if you don't have enough questions, I have a few myself, or maybe they do. So do we have any questions? Okay, right there, stand up and say your name and what your breed is.
My name is Cindy Brizes, and I breed Clumber Spaniels.
Great.
And I've only been doing it for about 6 years now. And I have a lot of people tell me that certain things you can fix in one generation and certain things you can't. And so I just wanted to get your opinion. Like I've heard, oh, heads, you can fix that in one generation. I haven't really seen that. Keep getting the same head over and over again. Bites, very hard to correct. So anyways, I just wanted your opinion. Is that true that some things are easier to correct more quickly than others?
Okay, you want to start with that, Moses? Team Moses here.
You know, anything can be done in one generation, but can you do it consistently? So if you do a breeding with an animal with a poor bite, that doesn't mean your whole litter's going to have a poor bite. You know, you need to just pay attention to that for quite a while.
And my comment would be, the pedigree that you're working with is an line bred pedigree. Are you line bred on poor heads?
No.
Because if you were, that would make it harder to fix. I find that shoulders are really hard to get and really easy to lose. Coat, hindquarters, a little bit easier to change. Everything is a little different, but you know, and you can't necessarily breed black to white and think you're going to get gray. It doesn't always work. I mean, sometimes you can get a moderation, but a lot of times you just end up with.
And either of you two want to add anything? I would just like to say I agree with Sherry. For instance, if you're getting consistently bad heads, my suggestion would be to line breed on a dog that's behind your bitch that had a good head, and the ancestor that you're bringing into line breed also had good heads. So that I think you agree with that might help you with that particular thing. And there are some things that are easier to breed out than others. But basically, what Sherry said, you know, look behind what's behind your bitch, and then go from there. Okay. Any other questions? I hope. Good. Thank you.
Michelle Caston, Skipper Keys. We have have a breed that notoriously doesn't have large litters. How important is it, because what I've heard is, if you breed enough litters, you're bound to find something good and go, on with that. But for a lot of us, due to many of the reasons, I'm limited to how many bitches I can keep, how many litters I can have, and I'm trying to proceed forward without having to breed 15 litters a year just to pick out, a bunch of good puppies. Some breeders are much better at it or luckier. Others do breed 15 litters a year, are called puppy mills on occasion, but they do get, the better puppies and we move on. I'm trying to evaluate what, quality over quantity, how to mesh the two together to do
So
this.
what is your question exactly?
Is a lot of it just if you breed enough puppies? My original mentor in Shepherd said, if you breed long enough, you'll see everything. If you breed enough litters, you'll get a lot of good dogs.
A famous person told me once, even a blind bird gets a worm once in a while. But we don't want to be blind birds here. So my answer to you, something I realized that I sort of forgot to say, because it's something I tell people. You need to figure out which bitch, which of your girls, figure out what is the best dog for them. I said that, find the best dog. What I find a lot of breeders do is they breed to what's in their yard. Or the best dog is the most winning dog, which, as we said, might not be the best dog for that bitch to give you what you want. Think about, you need to have a picture in your head what you want those puppies to come out looking like. And then try to figure out, well, how do you need to get there? And look at and a lot of, she's got her bitches, so hopefully they're of good quality. And a lot of times, it's instead of finding the best dog, and there's no, in my opinion, there's no excuse for that nowadays with the chilled semen. We can breed to dogs from anywhere. So, it doesn't need to be your best friend's dog, or it doesn't need to be the dog that's an hour away and you can get to him. And if you know how many times I have people say, I say, well, why don't you breed to that dog? Oh, I don't like those people. I didn't ask you to breed to them. I told you to breed to their dog. Write the check, don't go out to dinner. And I had to say that because it's true. How many times you have friends talking and they're like, oh, I love that dog, but I hate that one. I don't breed that dog. That's stupid. Stupid. Anyway.
Anybody else? You guys want to add anything down there? Okay. Next question?
I have a question of Dr. Greer about progesterone levels. I'm from the Pittsburgh area. I have plenty of mall terriers. I got my first one 13 years ago. I've been breeding for 7 years. I've only supposed to be my fourth litter. So very new breeder. My 3.5-year-old bitch came to the season not yesterday, but last Thursday in Pittsburgh. And I took her into my vet on Monday and had a level done. They did it in the office. It was 1.2. And she did a smear, and she said, oh, you've got plenty of time. And I was planning on bringing the bitch down here, and I was pushing up with the red, just a dog from this area. Brought her back in on Wednesday. Did another progesterone level, it was 2.3. She said, didn't do another smear, but she said, your timing is good, you got plenty of time. She said, I bet you end up breeding on Sunday. So I went out to dinner last night with the owner of the stud dog, who was also a vet, and she said, and I handed the bitch over to her, she was breeding that sort of thing. She said, well, we'll check the progesterone level today, Friday morning. And she said, I agree, we'll probably end up breeding her over the weekend. Maybe Saturday, Sunday, just depends what we see. Her level was 14 this morning, and she was bred today. And I'm wondering, is that common, or could there be a difference between my vet's machine in Pittsburgh and her machine here? Or did the flight just get her all excited?
You're lucky the flight got her excited because most of the time they stall out.
And
you're hearing,
that
yeah.
more than the opposite, which is what we got. So she's bred today, she'll be bred tomorrow, and we go home on Monday. So it worked out great for me.
Yeah, there's a reason we call them bitches.
She says that all the time.
Yeah, so you'll have them do all kinds of things, and what they do in one heat cycle isn't necessarily what they're going to do on another. So you're lucky that she didn't stall out while you were traveling, and your timing should be fine. So
To go from 2 on Wednesday to 14 on Friday morning.
Yep.
Not unusual.
That's the way they do it.
I was
So
thinking, why that's machine doesn't work.
well, and they're
my older dog, my senior neuter dog And I think he was all over her, and he was usually very good in there.
And you do have to make sure that the equipment is calibrated on a quarterly basis. Marshfield will run evaluations for other labs, so you can have that quality control done. But yeah, there's some variation, and if you think there's something wrong with the test, you can call the lab and ask them to repeat it, because sometimes there will be an outlier, there'll be a mistake on the way that the test was run. So most of the labs will rerun them for you because they'll have enough samples.
This is done right in my notes.
Yeah, but they'll often have enough sample left to repeat it if you have a request for that.
Okay, next question, yes?
Sheila Blanchman, new doctor. I have 2 litters of 4-week-old puppies on the ground right now. One litter, I purposely bred. It was a aunt and nephew breeding. I ended up with 3 puppies. The other litter, I tried to breed the bitch. She did not breed the dog I wanted her to breed. She refused, so I put her back.
With another dog.
It happened before daylight, which I was shocked because I looked at her and I'm like, she's pregnant. Well, she was pregnant. That litter, and I'm doing the DNA testing right now. I've already sent off. AKC told me that I have one dog that I thought could possibly be the sire, and I said, yes, my just sort of male is a Kennel. Sent it off. Doing the puppies now.
Question?
That litter is gorgeous.
See, they know better than you do.
That litter is better than the line bred litter that I did. And this would be an outcrop. That litter is gorgeous.
Well, your question? What's your question?
My mentor told me, she said, sometimes when the fish picks the sire, you come up with some good stuff.
So did you have a question?
Well,
No.
is that something that rings true? Or is that just something that happens?
The bitch knows best. There are certainly, that's one of the urban legends we have. I don't think anybody's ever been able to document it.
I do think though, when the 2 dogs decide to breed, she gets pregnant.
Big man of a blueberry bishop.
Yeah, exactly. Okay, any other questions? Yes.
Okay, so I currently have a singleton puppy at home that's 4 weeks old. Do you have any special advice for training, anything for, I find them the hardest to have. I'd rather have 6 than have 1.
Good for you, that's a great question. I actually have that question down. I'll start, but I'd like all of you to answer if there are tips for how to raise a singleton puppy, okay? And I'll start with my feeling. I'm talking now about more training, puppy training. I feel it is very important to get a singleton in a litter, or at least get another puppy for him or her by the time the singleton is about 5 weeks old. And it's got a little tricky if you're going to bring in another puppy because you've got to wean him off the mother, or at least not have the mother run the new puppy because she probably, my breed, she won't take to it too well. It just depends. But it is or maybe take the puppy and put it in another litter. I think it is very important that that puppy, by the time it's about 5 to 6 weeks old, has either another puppy with it or it gets in a litter. Okay, what do you guys think?
I agree 100%. We have a young male shepherd singleton that thinks he owns the earth. He thinks he's a baby Godzilla. He has no manners whatsoever. He's adorable and engaging and halfway thinks he's human, but he does not. He doesn't have all of the natural things that he would have learned by playing with another dog or having a mother dog teach him a few manners. And I wasn't really aware of it. I thought he was just so cute, and now he's a bit of a monster.
What about any medical ways to raise a singleton? Any tips?
I don't really have anything medical. I know there was a question earlier, I think from the lady with the dachshund, about the early neurological stimulation that Carmen Talia does.
Yes.
And that's the day 3 to day 16 protocol. I do that with all of mine, and I think it's really helpful whether they're singletons or not. Singletons can be really bratty puppies. And my first singleton was a near disaster. And I ended up doing a behavioral consult with him. And since that time, I'm much smarter on how I handle singletons. But basically, if you spoil them, they're horrible. and they can be horrible to the point of being dangerous. So you want to be really careful that the puppy's well socialized, and yes, as soon as you can get that puppy in a litter situation, it's much better for them. So you have to figure out what your resources are and see if someone will help you with that.
Did you have anything to add?
I think you would just add in terms of that, I mean, with that, the puppy can get some social skills from staying with the mom, but there are certain social skills they just really need in terms of the puppy to puppy and learning that. And with a single puppy, that's often difficult to find a way of mimicking that social interaction.
And it doesn't necessarily have to be the same breed, as long as the breed is more or less the same size and weight. You wouldn't want to put a small puppy into a breed, like a Rinser Dachshund into a breed with German Shepherds, where the puppies would be, might hurt it.
But in a small town, and they have a hard time finding that. I had a vet tech that has some live puppies, but then her husband didn't want me, with my puppies to have puppies, so it's just very difficult.
Even, I found, I've had Singletons over the years, and I hate it when I have them because it is a little more effort, but even if you could find a litter of puppies just to take the puppy to and have play dates, even that, I mean, even if they don't feel comfortable letting you have, their puppies, or you don't feel comfortable putting your puppy with them full time, just go and play with them let him play with puppies for a couple hours. Anything so that they get used to, that inner puppy action. They learn to talk dog talk and learn to know what it is to be a dog. Okay, next question. Is that the next question?
Just a comment. We have Bernie, and we've had small litters before, or had specifically, but I have a French Bulldog juvenile. Size is similar, still a younger dog, and that worked out well for the socialization. So maybe you can find a smaller breed, 8 or 9 month old puppies who still puppy-like. That might be able to.
What is your breed again?
Silver Spaniel.
Oh, okay, so your puppy's pretty good size. That's a very good idea. You can put it with an older dog, but smaller. Just somebody who's gonna put your puppy in his place. Yes.
I had a Scottish Terrier mix that had a Singleton, and I know how another person, anyway, I called rescue group. Anybody got litter puppies out there?
Good. That's a great idea.
And my Scottish, she had plenty of milk
Yeah.
and everything.
So you took a few in.
I took in 5 Cocker Spaniels, something mixed, and she raised us.
Good. That's great. It doesn't matter. It doesn't matter what kind they are, just so that they get used to a litter. Is this the same question or a different question?
It's a comment
Okay.
on that. I also run one of the larger skipper key rescues in the country.
Okay.
And I would be very, very careful doing that, because with all the shelters that are importing puppies, we've had outbreaks of brucellosis, which will wipe out the entire breeding program, parvo, distemper, rabies, and with all the transports going on, that's very, very risky anymore.
Well, of course, you've got to make sure that you know where the puppies are coming from. I mean,
The shelters won't know.
well, maybe you have a friend that had a mixed litter of puppies or something like that, or something. But it's just important to get them with another dog of some kind, either an adult dog that's small and their size or something, because they do need to learn to be a dog. Okay, do we have another question? Donna, state your name and your breed.
My name is Donna Gilbert. I am in Pembroke, Georgia, and president of Pembroke, Georgia, America.
That's plenty. Now you can ask your question.
You were talking about the different things that you should look for to have kind of in your toolkit and you mentioned things about how to separate dogs with the and you mentioned the mention. What should you look for in it?
Well, that goes back to where I said you might talk to a lot of people and everybody has an opinion, but then you need to use common sense. A lot of what we do in dogs really should be common sense if we would take a step back and think about it. I think for me, I was very, very fortunate. I had some of the icons in our breed, even though they were diametrically opposed of it. Joni Ford from Franjo Kennels, Mary Ellen Kish from Kismet, who was Dallas's breeder. Those two women were very much, they had stud dog envy, I think. And they had different outlooks on the breed, but they were both really instrumental for me for different reasons. And I tried to listen, absorb what they would tell me, and I asked a lot of questions. I chased people around. I try to absorb what they tell me and then make decisions about the value of what they're saying. You can learn a lot from a lot of different people, but when it comes to actually a mentor, probably someone with experience in the breed, someone with some history in the breed. And I think in dogs, I saw something in an article about most people are in and out of dogs in 5 years. I don't think I would be looking for somebody who's very new to the breed that's just had tremendous success. I might talk to them, but I don't think I would put them on my speed dial until they show that they're there for the long haul. And I would look for someone who was like-minded and someone who was willing to talk to me. A lot of people, they'll tell you the superficial thing, but they won't really get to what you need to go to. For whatever reason, they're afraid you're going to go tell somebody. But somebody will be honest with you.
Anybody else want to say anything about that?
I think in terms of mentors, I agree with everything you say, and also finding someone who will be brutally honest is very, very key, because if you're being mentored by someone who's just telling you what you want to hear, they're not really being a mentor to you. So it may be one of those cases where you have to be a little thick-skinned and listen to what they're saying, because if you're just listening, if they're talking and you're just sort of letting it roll off, it's really not going to do you a lot of good either, too. So you have to step back and be willing to evaluate what they told you and learn how to use that.
That's very important. Okay?
I'm Susan McGee, some of the interiors, and I have a follow-up question. We always ask about mentors, but what is a good mentee? Okay? How, because people get tired of mentoring someone if they're not willing to. So, if you all had to put a description on what a good person would be like if you could mentor, what would be those characteristics and traits?
Jeff has a pet peeve about people that, I saw this cute word on the internet, that are askaholics. They ask you all these questions, and you spend time and effort and time and effort and time and effort, and then they go do what they wanted to do anyway. And okay, well sometimes, somebody, my sister was helping me clean my house the other day, and there were some things I was getting rid of. And most of the time, she said, oh, you should get rid of that, get rid of that. I'm like, okay. Well, there was this one dish, and I said, I like that. She said, it's ugly. I said, I don't care, I like it. Okay, well, every once in a while, it's okay to do that. But if your mentor is trying to help you, don't every time they try to tell you something, tell them you're not going to do it. And it's not that you have to do exactly what they say, but you need to pay attention and not just, some people, I think they just talk to hear themselves talk. And then they're doing what they're doing anyway, and you've wasted your time. I think you need to be respectful, but it's okay to ask questions, and they should be willing. If they're going to be a good mentor, they should answer you honestly. And honestly may or may not hurt your feelings sometimes if you really love the dog, but hopefully they're going to be kind about it. So Mr. Moses probably has things.
The only thing I'd like to add to that is that whenever you think you know everything about dogs, any of us, they'll certainly prove you wrong the next day. But with that being said, there are certain things that 99.9% of the time, if you do A, B is going to happen. And when I tell someone that weekly, monthly, and out of 50 times, 49 of them, they pay no attention, my life's too busy. And when you win a lot of dog shows in this business, people put you on a pedestal they should not. If I didn't have the dog, I couldn't win. But in the same token, I'm half deaf, and sometimes people think I'm ignorant because they pass me and say hi. She has to kick me and I have to run them down and grab her. just to make sure that if, you know, you always have to act nice to everybody because you're under a, you know, a glass bowl. So I try, if someone has a question, I go out of my way, even if it's not convenient or I'm too busy. But after a certain amount of time, when I tell people, 99% for sure this won't work. If there's a 50-50 chance, in my experience, I tell them that too, but after you start losing your patience with people, and I see their name pop up, I just press that now on the button.
I mean, just one other little thing though, but if you've, I personally, I think I was a frustrated school teacher, but I enjoy mentoring people, and it's one of the most, you know, and when someone you mentor goes off, I talk about my grandpuppies, you know, when someone you mentor goes off and does well, I mean, for me, that's one of the biggest joys in dogs, is having somebody that you brought along be successful. I mean, that means you're doing a good job, and you know, it's like it's a reward for the mentor, and I really enjoy that. You just have to be, not be an asshole.
Marty, Lola? Anything, Jeff?
Yeah, I think in terms of that, I mean, I know when I talk with my mentor and then mentees, early on, I think it was broad conversations, but more effectively I've found over the years, have a specific area that you want to discuss in a single meeting, keep it to that. If it's over lunch, then discuss the point of interest, and then move on to checking on the family and seeing how things are going. But I'll try to make too many topics in one given meeting, and give either receive the advice or give the advice, and then follow up on that down the road to see how things are going. But try to keep it within a defined subject.
The best advice I ever heard about for a mentee is that if you're asking your mentor a question, if you have the good sense to ask that person a question, have the good sense to follow their advice. Okay? Anybody else? Okay, how about you?
My name is Dr. Mary Krause. My question is to Mr. Moses, and I just wanted to ask the question of what is the most important thing that you've ever learned as being a manager?
To be successful with a dog, you need to get inside of their head. And by far the most important thing. Well, number one, you have to know dogs. Because, you can be a good handler and you can help them, but it's hard to make chicken salad out of chicken shit. Uh-oh. That's why I don't talk much. He said, nobody. Anyways, with any of my better specials, the first month they were with me, or 6 weeks, if I went to the bathroom, they went in there with me. I mean, they were never out of my sight until I really got inside of their head. And to make a long-term successful show dog, if you don't have that, you're not. And, some dogs could make the cleanup man look good, but that's rare. Most of those dogs, you need to get inside of them, and you train them, but you don't make them look trained. And that's the secret to it. But if you don't get inside of their head, you're not getting them.
Anybody else want to add anything to that? That's a great question. Any other questions? Okay. How about you?
I'm Sherry Catledge, and I'm a rear owner of retrievers. And I'm going to admit that I'm around long enough to remember each of you with Adam. Okay, so
We could have made a cleanup man like that too.
But my question is for Dr. Prayer. As breeding these dogs, talking to my peers and my friends, there's a much higher incidence now of reabsorption of puppies than there's ever been before. And some people have suggested or intimated that with the surgical procedures, opening the dog up, that there's a higher incidence of reabsorptions after surgicals. Have you found any correlation between that, and why are we having? I mean, it's happening that dogs are bred. We have an ultrasound done at 28 days. see them on ultrasound, go to get an x-ray, prior to their due date, and there's less puppies, and even by the time that they are whelping, my repro vet's gone in and found reabsorption nodules, and it's happening more and more. I know in retrieve breeds, I'm not sure about anybody else, but what are your thoughts on this? Are we doing something wrong? What's happening?
Well, I don't think there's a correlation between surgical breedings and resorptions. When we breed surgically, we just put a 22-gauge needle or a catheter into the uterus, so that's not going to be large enough to interfere with any placentation sites. So that shouldn't cause the fetal loss. One of the discussions about why we see more resorptions is that before we didn't know how many puppies we had, before there was ultrasound. So, when I got out of vet school, we didn't have ultrasound machines, and that's something that's a really relatively recent change. So we'll ultrasound and think that we see, for instance, 8 puppies, and then if 4 are delivered, did we miscount? Did we really see puppies that weren't ever really meant to be, and we wouldn't have known that there were 8, and now you're down to 4 if there hadn't been an ultrasound? There's no indication that ultrasound is the cause either, and that's another piece of discussion that every now and then shows up on some of the breeder lists. Are there infectious causes? Are there environmental causes for resorptions? There are, and there's also a lot of changes that occur in the uterus that interfere with good fetal development and complete fetal development. So we don't know what all of them are. It's difficult to test for all of them. There's some labs that will do some testing for the infectious causes, but to try and, if you hear people say, well, test the water, and what are you testing for? There's just a lot of questions that we have about resorptions, and I agree, we don't understand what they all are. It's frustrating to see it.
I remember sending the bitch on a plane to go get bread. The days of having to do that now, we have things going in, I collect my dog, I ship it off. Things have changed totally of what we used to do 20 and 30 years ago. But it seems now, the repro vet went into my picture was she can actually see the reabsorption nodules there.
Right.
And said that if you have that one time, chances are you're going to continue to have it. It's not something that's one time.
Yeah, and that may be an older bitch that has started to develop uterine disease, cystic endometrial hyperplasia, or some other uterine disease. It could be infectious. It could be that we're just breeding some of our lines way too tightly and we're ending up with fatal genes. So there's a lot of different reasons for resorptions that we don't fully understand. I agree, I think it'd be something interesting to take a look at, but it's a pretty difficult challenge to try and determine. There's a really nice panel that they do at Cornell, the canine abortion panel, which doesn't just apply to abortions, it would also apply to resorptions. And it could be a paired blood sample that can be done. We can do uterine biopsies. There's all kinds of things we can do to try and chase it down, but we don't always find the cause even when we look. Even in the cattle industry, where they have a huge economic loss, if there's an abortion storm in a herd or anything else, they still only usually find the cause of those about 30% of the time, and they've thrown a lot of money into that industry trying to determine the cause. We don't have that kind of money in the dog world right now to be looking at. It'd be lovely if we did. If somebody wants to fund it, I think that'd be great. AKC probably has a Canine Health Foundation program that they'd like to work with.
Well, with our horses, I've had them for, I'm sure if you have twins, that's not the preferred thing. And the vets always say, well, normally one will get reabsorbed, but that's something that you want, because you only want them to deliver the one. So there's a lot more out there that we just don't know.
I'm just going to build on that a little bit. I'm sure that the actual knowledge of the reabsorptions are increased, but in terms of at least the data that I've seen, I don't believe the actual event has increased because litter size has not decreased for at least the breeds that I have data for. Litter size seems to be, if anything, increasing slightly. So I don't believe that reabsorption is increasing our awareness of it. Maybe, as you pointed out, it's similar to dealing with cancer rates. Cancer rates are more prevalent, but we're much better at diagnosing those diseases than we were years ago. But we're not seeing decreases in litter size, and the lab is one of the breeds that I keep up with, and that actually continues to creep up in terms of average litter size. So I don't believe that its absorption is increasing. It may be, I will say that the age that's being bred is increasing as well. So older bitches are.
Breeding, you know, because we want to get the dogs now that we have, you know, grand champions. You know, used to be you get a championship, and now it's the time to settle back and start breeding. But now we're keeping the dogs out more, and so we're breeding later. First,
We're gonna just have one more question and then we're gonna have to wrap it up. One more fabulous question out there. Okay, you get it. You. You have it.
I have a question about probiotics. I use Prostora for different things, and also Fortiflora. It's a lot less expensive. I need to throw something at someone, I'll go to the cheap little box of powder. But if I have a upset gut, we're going to put on antibiotics, and I want to boost them back up, I get that. And when I had my muscular puppies, and I had some soft stools, as now I know it's very common in puppies, I asked the vet if I could give them any kind of probiotic, because I thought they would help them. They said, oh no, not until they're at least 6 months. Well, by then they were gone from me. And it sounded like, unless I misunderstood you, that you're giving probiotics to puppies or just to the pregnant bitch?
In terms of that, I will say that there's not a lot of data out there in terms of young puppies. But with that said, at least with the strain that you're using in terms of the Prostora, we know that lots and lots of bifidobacteria is transferred to the puppy through the milk. There's bifidobacteria incorporated into the milk by the bits and is transferred to the puppies. In fact, in terms of their bifido populations, pretty close to weaning is going to be when their life as far as bifido concentrations. In terms of the study that I presented, we started administering that at 35 days of age. And in terms of the Prostora, the supplement that's out on the market, the levels that we use would be, we took one of those treats and cut it into 4 pieces. 4 or 5 pieces would be about the dose that we were giving those young puppies. In terms of that, I would not be, I guess, eager to give just any probiotic strain to a young puppy. That particular strain doesn't bother me because it is a bifido, but at least there we know that we've looked at that in growing puppies. I've done studies in terms of the tolerance studies where we've given 50 times the dose that's effectively in Prostora in growing puppies without any side effects. But I don't have that data on just any strain. And as I mentioned earlier, each of these strains are going to have different effects and interact in terms of the GI tract differently. But more and more information is coming out on that. And what I said about doing your research, I think work with your vet in terms of any strain that they want to work or I guess offer you, or if you're thinking about using one, make sure that it's at least been used or shown to be safe in the canine. Sort of find out what type of animals it's been used in. I know for that particular strain, I'm very, very comfortable with it, giving it to a young puppy. I think the youngest I've ever given it is 30 days of age. And that was with some puppies that was with a rescue bitch that was having some pretty substantial issues. But with that particular one, it doesn't bother me because it is a bifido, which is commonly transferred from the bitch to the puppies naturally.
Would you recommend giving a pregnant bitch maybe a week before she's due, a week?
Certainly we know in terms of that particular strain, the AKC7, it takes about 2 weeks for it to reach a point of stable populations. So if you're looking at that, probably we did not see any benefit during the gestation. So I would basically say if you could start around in between day 50 and 52 of pregnancy, you should have time to get a substantial population presence and colonized before she whelps.
We're talking about a healthy bitch, just to give her that advantage that might pass along to the puppies. Is
Right, and I can't comment on that. We do not have any data that says we can increase the amount of Bifido that she's giving. But we certainly know in terms of her managing through, from a GI health standpoint, managing through the challenges of that early lactation period, that we get a benefit there. No.
All right, well, we certainly wish to thank everyone for your participation. Before you leave, our chairman of the board, Alan Coulter's here with us, and we wish to thank him. This was his idea to have these seminars, and we appreciate that. And please, once you see these folks again, we look forward to having some feedback from you. And you'll be able to see these presentations up on the web if there was anything that you missed. I know some of you have been in and out throughout this afternoon, which is great. And thank you very much. Enjoy the rest of the weekend. And happy